Good evening. At this time, we'd like to call to order the Policy and Services Committee for Tuesday, 2015. Would the clerk please call the roll?
Councilmember Du Bois?
Here.
Chair Burt?
Here.
Councilmember Wolbach?
Here.
Councilmember Berman?
Here.
4 present.
Great, thank you. And our first order of business is an opportunity for the public to speak on any item that's not on the agenda, and I don't, pardon me. I have 2 speaker cards. Should I be turning this mic on or not?
No, the silver one is the one that you're using.
Okay, great. Our first speaker is Rachel Kellerman, to be followed by Sue Eldridge.
Sue is actually for agenda item number 5.
Oh, I'm sorry. Got it.
I didn't. Is it
Thank
this
you.
night?
Yes, ma'am.
Okay.
Thanks. Good news about the Giants, though. No. Okay, my name is Rachel Kellerman. I live on Emerson Street and work as a teacher librarian at Palo. Like many Palo Altans, I believe that increasing airplane noise due to the FAA's new Metroplex routing system is impacting our health and quality of life. Now that I'm on summer break, I have started to research this noise pollution issue. Today, I spoke in length to Bert Ganong, the manager of noise abatement at San Francisco International Airport. I wanted to know by what process the FAA was allowed to essentially build 3 jet superhighways above Palo Alto without our citizens and our government resisting this action. I learned that unfortunately Palo Alto did not raise its voice forcefully enough to convince the FAA to modify their plan. Thus, 3 jet arrival routes now converge well under 5,000 feet, roughly above Embarcadero and 101. Also, unfortunately, Palo Alto is currently not a formal part of the SFO Community Roundtable, an organization of cities in San Mateo County that consult with the airport about noise-related issues. The good news is, Mr. Ganong said he would endorse a noise study in Palo Alto near the point of route convergence using SFO's mobile noise monitors. I contacted the Palo Alto Airport manager, Mr. Swanson, today, and he indicated that he will follow up with Mr. Ganong about gathering noise data. I urge your committee and the City Council as a whole and city management to make conducting a comprehensive jet airline noise study a priority. Our city needs to work with the FAA to adjust these landing routes so that they are better dispersed throughout the area. We all deserve quieter skies. Thank you very much for your attention.
Thank you. And we have one additional speaker on oral communications, Sherry Furman. Welcome. Oops. We're okay.
Obviously, I got here just in time for that. At a recent PAN meeting, it came to our attention that a member of the Architecture Review Board is representing an applicant before the board. While this person obviously will not participate in the discussion of the application, many of us feel the fact that the person is a board member will have an undue, even if unintentional, effect on the other members. While I know you have a busy schedule, I ask that at a not too far distant date, you discuss the appropriateness of having active board and commission members represent applicants before the board on which they serve. And note, while this issue came up at a PAN meeting, this is strictly my own request. And I apologize if this is already in your policy and services manual and I just have not managed to read the whole thing. So thank you.
Thank you. So now we'll proceed to our first agenda item, which is the Project Safety Net Community Collaborative Update and Recommendation for Next Steps.
We'll have our ensemble cast here.
May I just make a statement?
Sure.
Just wanted to clarify the committee that, we formally have assigned Ed to be lead staff to Policy and Services and Suzanne from the city manager's office to finance. So we sort of look to Ed as lead, and I'm here as staff on certainly at least the first item. Thanks.
Great. Thank you. Rob, welcome.
Yeah, good evening, council members. Rob DeGoche, Director of Community Services, and been involved with Project Safety Net supporting youth well-being and suicide prevention for some years now. As a department, certainly we're doing a lot of work there with this council and the city. It's a collaborative. The city's one partner of many partners, and so that's why you see a few more people at the table than just city staff. So the first thing we could do is just introduce folks that are here. We'll start with Nina, city staff, and she is the manager of Office of Human Services and is the co-chair of Project Safety Net. Go ahead.
Sounds like he just introduced me. As you all know, Minka Vandersog, Human Services, and co-chair with my partner from the school district of Project Safety Net. I'll let you introduce yourself.
Thank you. Yes, my name is Brenda Carrillo, and I'm the Student Services Coordinator with Palo Alto Unified School District and also the co-chair of Project Safety Net.
Hi, I'm Sue Elsbeth, and an interested Project Safety Net community member.
And Leif Erickson, Executive Director, Youth Community Service, one part of the founding partners of Project Safety Net.
Shashank Joshi, also a founding member of Project Safety Net, also representing Lucille Packard Children's Hospital and the Herd Alliance. I'm a child psychiatrist, pediatrician, and Little League coach.
I'm Pamela Garfield. I'm a licensed clinical social worker, and I've been the site director of adolescent counseling services at Glen High School this year. So I've been on the front lines of all. Can you hear me? I've been on the front lines this whole year and support Project Safety Net, and I'm on the leadership committee with these folks.
Well, thank you. So we do have public speakers, so I think what we'd like to do is, I'm sorry. Go ahead and have the staff presentations, some initial questions, and then hear from the public, and then we can have discussion.
Terrific, that sounds great. We have a few people participating with the presentation. We do have a PowerPoint. It's a little difficult perhaps to see, but it's behind you. Yeah, and Minka's going to kick us off.
Great. So again, we're very happy to be here this evening to share the work that the Project Safety Net Collaborative has been doing over the last several months to be able to bring this presentation to you and the work of collective impact and that concept for your review. I'd like to do a little quick review of the presentation for you this evening. We'll be speaking about what brings us here tonight, and that was the referral last fall from the Project Safety Net presentation to the Policy and Services Committee. One back. There we go. We'd like to give you some key touch points of PSN's work this school year. We'd like to do some sharing of a meeting we had with experts in suicide prevention that we had this spring. And we'd like to give you the information about the collective impact approach that PSN has identified as a workable model for staffing and structure, and talk about some next steps that we have for next year. So the Policy and Services Committee that happened October of last year. So at that meeting, the Project Safety Net Leadership Committee was there along with Rob and I as staff with the purpose of providing an update on the work of Project Safety Net. We discussed the difficulty that we had in retaining staff with our current staffing model. We had had 2 directors in 18 months. We shared with the committee a conceptual idea that the Project Safety Net leadership team had discussed regarding using the remaining city Project Safety Net funding to provide grants to partner agencies in the community that work on suicide prevention and youth well-being. The outcome of that meeting was that the Policy and Services Committee was not really supportive of the concept that the city would solely become a funding agency for Project Safety Net efforts. They saw and expressed to us a real value in Project Safety Net was that gathering together of the collaborative members and that cross-functional and cross-agency work. And they directed us to go back to look at alternative staffing and structure models for Project Safety Net and come back to you. So I'd like to have my co-lead, Brenda, just talk a little bit about the work of Project Safety Net this last fall and spring.
Sure. Well, as all of you can probably imagine, there's been quite a bit of attention on mental health and suicide prevention and intervention, and unfortunately postvention across our community, given that we've had a number of teen deaths since October 2014. I think it's not only been difficult for community members, including our school staff, to deal with the actual crises in front of them, but being triggered by the past cluster that we've had. Many of the people who are in our schools were there when we had our first cluster of suicide. So it's been a very intense year, a very difficult year for the schools, and I imagine for all of us. Despite that, we have continued to move the Project Safety Net agenda forward and to really focus on what more we could be doing to support our students, our families, our communities. And I just will highlight a few of the bullets that you see here. We did have quite a bit of crisis response on our school campus. We're very, very lucky to be in a community that cares so much about children, and I think we owe a lot of that cohesion and sense of collaboration to Project Safety Net's work, so that when we had the crises on our school campuses, we were able to call on our agencies to come and provide support. At one point, we had 14 agencies represented on our school campuses to really come together and respond. There's means restrictions efforts that are happening across the city. I'm sure you're well aware of those, so I won't spend too much time on that particular bullet. We had an opinion leaders conference, which I think Shashank will be talking about in just a little while. One of the items that I would like to highlight that is up here is that we've done quite a bit of outreach in the last several months to the CDC, Center for Disease Control. We have a strong interest in having the Center for Disease Control provide us with some support. We really want to understand what it is that's going on in our community that has brought us to this point of having lost additional students. And we feel that the best organization to help us to really understand what some unique factors might be in our community is the CDC, and there's quite a process to access their support. You have to go through local channels and then state, and finally you move yourself up. But we've had a couple of meetings with the public health department already to talk about what could be offered at the local level. We have also been consulting with the Daleen Dutton with Communities That Care to help us to understand what kind of help we should be requesting. And based on our conversations with her, we're very hopeful that the CDC will be able to help us in a couple of very specific ways. One of the ways in which CDC supported Daleen's community, because they also had a cluster of suicides, was that they came out and they were there, she said, for a week's time. So they literally come in and they're here for an intense amount of time. They really focused on their work, and they were able to access databases and systems and organizations in a way that we're not able to do. Like ambulance, they looked at ambulance roster. They looked at 5150 information for hospitals. They were able to really go in and pull information out to help the community to understand the scope of the problem and the depth of the problem in a way that I don't know that we've quite gotten to. The CDC was able to come in and do focus groups with communities. They had over 400 participants in these different focus groups to really understand what are the community norms, values, and expectations around suicide prevention and mental health. And at the end of this short amount of time, again, they were here for a week, they produced a report that the community was able to use to guide their next efforts. And so we're very, very interested in having their support here in our community, and we feel like that would be a great advantage to us in terms of our work with Project Safety Net. There's been, I'll move on, various workshops that have been provided, parent workshops. We did some work around the role of sleep. We're actually adding sleep questions to our California Healthy Kids survey that would be administered. It's a statewide survey that's administered to grades 5, 7, 9, and 11. We're trying to understand how sleep may be impacting our students in a way that we've not understood before. So we've consulted with Stanford's, with Dr. Joshi, as well as other professionals over at Stanford to really help us to understand what kinds of questions we should be adding to our survey. What else do I want to say here? We have been also doing a lot of work in reaching out to parents in a culturally responsive way, increasing our outreach to Mandarin and Cantonese speaking families who have been very much impacted by the deaths that have happened, as well as our Spanish speaking families, and making sure that they're receiving the kind of support that they need as they move forward. And so in addition to that, we've been doing a lot of parent education overall, but really focusing in on subgroups within our parent community. And we continue to do school-based QPR training. I know that the city has also has QPR training that they're administering through their different means, and so we are wanting to get more and more people trained on question, persuade, and refer, which is a gatekeeper training, so that they can respond. Another highlight that we wanted to share is that we have also been doing a lot of work to promote this idea of the youth voices. So we had 2 youth forums in this last school year, and really the idea was to get students involved and to have their voice in what they think they need and how we can best support them. And so there were several events that were held. One was by the community and the other was sponsored by a diverse group of community partners. And again, the idea was to collect information from teens about their experience and what they needed moving forward. We also had the Palo Youth Council did a joint study session with the City Council, and that was very helpful in terms of, again, gaining information on youth voice. Every year, the district partners with the city and others to support Youth Speaks Out, which is an art show, and it's a way of helping students who may not want to articulate or voice their feelings to do that through art. And so it's a very powerful partnership that we have in promoting artistic expression of mental health. We also, most of you probably know, have a program at GUND that's called Sources of Strength. It's a peer support program, and that program will be expanding to Pali next school year. And in addition to Challenge Success, which comes out of Stanford, which is another program that both of our high schools will be implementing, we're very happy with the fact that our 2 new high school principals are doing a lot of work to make sure that the programs that exist at both of our campuses are similar and are in line. Minka and I were, well, Minka's going to have an intern, and the school district is also going to have an intern working over the summer. And so we were having a good conversation about how we might have our interns work together to promote this idea of whether it be stigma reduction or providing more resources and support to our community. We haven't decided yet what that's going to look like, but there's lots of partnerships that we're continuing to explore.
And I think part of that was continuing to value and hear from youth, and both of these youths are transitional age youth, so there are youth that have been to our schools in Palo Alto and really have an interesting perspective to share with us. On the next part of the presentation is really a really interesting opinion leaders forum that Dr. Yoshi pulled together in March of this year. And a key and core value of the collaborative is continuing to learn together. And this is ever more important in the midst of our current period of suicide contagion. So Dr. Yoshi called together an opinion leaders forum in March, and they shared a lot of best practices for suicide prevention. And we've asked Dr. Yoshi to just give an overview of that event. I know Chair Burt was at that event, and that was very wonderful to have you there and interested in the work of Project Safety Net. So Dr. Yoshi will let the others of you who weren't there to give some highlights of what happened.
Thank you, Minka. So thanks for inviting us to be here. One of the 5 conditions for collective impact success is known as continuous communication. And one of the aspects of our community collaborative here that one of the leaders there, you see their names up on the screen, Mort Silverman, who is the senior science advisor for the Suicide Prevention Resource Center, which is really one of the most important suicide prevention organizations in the world. He's been doing this for 35 years. He's best known for some of the work he's done with the JED Foundation, which really concerns itself with transition age youth. And he's also done a number of projects with the big parent groups that look at suicide risk factors. So one of the first things he said to us that day, after hearing brief presentations from our community leaders, was that in his more than 35 years, he really hasn't seen anything quite like this. We're unique in our risk factors because of the easy access to means, but we're also unique in our strengths as a community in terms of how we've come together. And he also noted the success of the last 4 years in terms of what the community has done to try and mitigate the issue of teen distress and completed suicide, particularly with regard to suicide cluster. They mentioned some of the best practices that we have already been engaged with, such as gatekeeper training, not only for adults, but in our community uniquely, we've really made it mandatory for all teenagers in our public schools to get trained as gatekeepers through QPR, and now through Sources of Strength, which is another best practices program that our group's actually doing research on, not only in our community, but in other communities in the Bay Area. Peter Wyman, whose name is up on the board from the University of Rochester, has done a lot of the research in that area. We are one of the sites in that big study. He also talked a lot about both upstream universal suicide prevention and mental health support a little further downstream, and then furthest downstream, the efforts of the city to engage Caltrain into best practices means restrictions, because we know that means matter. And we did not have one of our most recent, Lauren Barley-Schlemmer, who's been quite an advocate for downstream prevention, but Mort Silverman and a couple of others who have had experience with trained suicides and youth suicide in general really pointed to that as a very important next area to focus on. There was also a focus on things like prevention. So again, with our very unique board policy and administrative regulations that the school district passed in 2010, which allows best practices to come into the classroom, to take instructional time to be able to teach these very important skills to peers, to not only look for distress in their friends and how to get help, but how to recognize when they themselves are under too much stress, turning to distress way before it gets to desperation. Other highlights included the role of sleep in prevention and the role of sleep deprivation or sleep problems as a unique suicidal risk factor across the lifespan. That's been shown worldwide in data over the last 5 years. Rebecca Berner, who heads our suicide prevention laboratory, highlighted some of her national and international work looking at sleep issues across the lifespan. I actually think that discussion resulted in a lot of very important talks at the school board level around school start times, again, bringing in the experience of people nationally who've had experience with other communities like ours. Brenda and Minka mentioned Daleen Dutton from the Communities That Care initiative that's going on in Maine. In a community, Camden, that is very similar to Palo Alto in terms of demographic makeup and what they struggled with and what they've done. And that model lends itself very nicely to collective impact as well. Finally, best practices in media coverage was a theme. We had Doreen Marshall from the American Foundation for Suicide Prevention give us examples of what are appropriate ways to cover suicide and to cover, say, the backstory if that is to be done and how to do it, and some examples of how not to do it. That, again, is an ongoing conversation. There was just another media roundtable today that I participated in that I think was fruitful and is something we're going to need to continue to do. Finally, Brenda mentioned our ever increasing diversity in the community now, with about 40% of our student population being Asian American, a large number of those kids being children of immigrant parents. And how do you culturally adapt and attune all of your intervention and prevention kinds of initiatives so that those for whom you may not have intended the message was not received? How can you conduct culturally syntonic community forums, as the district has sponsored, I think 5, along with the hospital and Department of Psychiatry, partnering with community agencies like ACS and ACCI and other places to try and reach our growing diverse community. So those will also continue, and that comes back to where I started, which was the idea of continuous communication, making sure that everything actually goes through Project Safety Net. Whenever all of these specific examples I've mentioned, they sort of have acted as a clearinghouse to make sure the right hand knows what the left hand is doing. And that brings us back to why we've chosen collective impact. We have all of these ideas, We had a flight into health, if you will, for the last 4 years. Relative health, I think we from where Pam Garfield and I sit, we do still see these kids who come in with distress. I think the community is better equipped now from a capacity point of view, not only to handle those in distress, but also to know what best practices are when we're in that period where we're not losing kids and adults regularly. But we still have a lot of work to do. I think this model provides a nice roadmap for us, given that it's been demonstrated in other cities like ours to really make a big difference.
Thank you, Dr. Yoshi. Before going any further, I'd like to introduce Kathleen Blanchard, who is an original member from Project Safety Net from the beginning and is a member of our leadership team. I'd like to go on to the next slide. We are here today to talk about the collective impact model, and I just wanted to very briefly talk about the process in which we went through to bring this model to you today. So we comprised a subcommittee, and that was members of our leadership team, current and past leaders of Project Safety Net. We really felt like we needed the perspective of leaders which had been with us since the beginning, as Leif introduced himself as being one of them, and there's a full list in your staff packet. They gathered and they reviewed several models for staffing and structure. And the approach that they came away with, and which was subsequently reviewed by the school district executive staff, by Jim Keene, by the full leadership committee, was that of collective impact. And we're really grateful for this very intense work that the subcommittee did in this regard. And Rob will spend some time explaining collective impact to you.
Okay. I think that's on.
Okay.
So I'm going to move through it pretty quickly because I think we want to get to the discussion, and you've seen the staff report, and so we talk about collective impact, and just it's defined up here. It's when organizations from different sectors agree to try and solve a social problem and align their efforts around a common agenda. And in reality, right, Project Safety Net is doing that already. That's what we've been trying to do for the last several years. Collective impact is kind of the latest cutting-edge thinking around how a community does this type of work. There's lots of different models that one can use. There's communities that care, you heard about that. There's positive community norms. There's healthy communities is another collaborative type model. But collective impact was one that we sort of landed on because it really fit well with the work that we're doing here in Palo Alto. And we also had some leaders that are part of Project Safety Net that are in a collective impact framework already. Leif Erickson in East Palo Alto was working within a model like that. Terry Godfrey on the school board is as well. And Sue Eldridge, she's back here, was executive director of a really innovative collective impact model in San Francisco, which is, they did some great work. So we had some deep knowledge internally, and so we landed on this and thought this was really a good framework for Palo Alto and for what we're trying to do. So on the next slide, really the best way to think about collective impact success is these sort of 5 conditions. They call the 5 conditions of success for collective impact. And I'll just go over them really quickly. A common agenda is the first one, and we largely have a common agenda. We have a 22-point plan that maybe the new council members haven't seen, but when we had the first cluster of suicides, we developed this very robust plan that had intervention, education, and prevention strategies. That still is very relevant and a guiding plan for us. And then we have a more succinct one-page plan that also supports sort of a common agenda. I think we still need to tighten it up even further, and that's some work we need to do. But common agenda is the first condition for success. The second is shared measurement. And the idea here is that we have a clear agenda of what we're trying to accomplish, but we're sharing how we're doing across sectors. So the city's doing certain work, right? We're working with teens and youth. This summer, in fact, we have several thousand kids in our program, but we also hire like 200 teens to help us do that. And that's a program we support them and mentor them. We have a teen center that we run every day, and we're measuring our work. But is our measurement of that work aligned with how the district is measuring their work, and is it aligned to YCS and some of the other organizations. So the idea is if we have a clear common agenda and we're sharing our measurement and adapting to that feedback that we're getting continuously. The third thing is mutually reinforcing activities, and that is aligning. The best way to think about this is with an example, I think. We talked about gatekeeper training, where we train non-medical staff on the basic tenets of what one needs to know if someone is in distress and how to help them and how to have that conversation and get them the professional help that they need. We're doing that training for all city staff, library staff, human resources staff in the city. The school district is teaching all of their secondary teachers and coaches, YCS, YMCA, all teaching their folks that are working with kids this sort of basic level of training. Developmental assets is another example. We've adopted developmental assets as a framework for how to think about youth development. YCS has adopted that. The district is doing a variety of things related to developmental assets at each school, the YMCA, the city. So mutually reinforcing activities. Continuous communication is the other sort of investment that a collective impact organization or group needs to work on. And it really relates to trust and respect and building relationships. And largely that's what Project Safety Net is. It's bringing organizations that impact youth in some way, or people, individuals that care about this topic, bring them together and build authentic, genuine relationships among them, and then true collaborative initiatives can seed from that. And the last is a backbone organization. This is kind of an interesting one. Collective impact, the model, the framework suggests that there is a separate backbone agency that is not one of the partner organizations that is embedded in the work of supporting youth and young people. That in fact it's an organization that their only job is to actually support the collective, the collaborative. It doesn't have to be big, but the idea is that it's a handful of people. That's what they do. They bring people together. They support the continual communication and the shared measurement across the different sectors. So they're sort of the five tenets of collective impact. Real quickly here, we think that this model will create greater accountability, will strengthen the alignment of activities across the sectors and the 30-some organizations that are part of this collaborative, and will sharpen our communication and understanding. The last page on this, I think, Minka, if I'm right?
Yes.
Okay, is developing a clear roadmap for what we're trying to accomplish. And others can speak more eloquently than I can about this. So, but the idea is having a really clear roadmap that we can share with the public and with students, so it's really clear what we're trying to accomplish and define it. And the roadmap needs to be meaningful, that it gets us to where we want to go, and that is to save lives and to create an environment where youth thrive in Palo Alto. That it's plausible, that we're making bets on these things. We're investing in certain activities, and we're making the bet that if we focus on this activity, it will in fact impact our end goal, our outcome. So it has to be plausible, and it has to be testable. What we're doing that we're testing, there is some type of scoreboard that we have that can say that yes, we are actually getting closer to reaching the objective, and it has to be doable. And that means we have to have the resources available, and we have to have partners that are truly engaged and fully engaged, particularly those that work very close to young people. So the roadmap and collective impact, we're doing a lot of this already. I think there are areas where there are significant gaps that we don't have and that we need to have to be truly effective. And so that's what we'll work on next if we get the support of funding.
So with that grounding that you've just received, that's the same type of grounding that our collaborative worked on at a recent meeting to really understand the concepts of collective impact and how it can make a difference. And from that point, we felt it would be really important to take a next step before we came to you today. And that next step was to call in 2 experts on collective impact. And one was Daleen Dutton, who has been introduced to you by a couple of my colleagues at the table, who runs a collective impact collaborative in Maine and a community that's very similar to ours. And the other is Dr. Jim Connell, who was brought to our attention by Sue Eldridge, who is the executive director of the Institute for Research and Reform in Education, but in that role has been very vital to very many organizations that have worked to institute the collective impact model and worked with them to set up this roadmap. What do you need to do? What does it look like? How will you know you're being successful? So those 2 leaders came to us on May 7th to lead a workshop. And the real purpose is to really look at, what really matters in the lives of our youth, and that which efforts do we do and what efforts should we do that really make an influence and a difference in the youth that we're trying to reach. We had the key work that we did that day was to do a mapping exercise to look at what we'd already done in Project Safety Net against a data framework under prevention, intervention, and postvention, and the types of youth that those efforts had reached. And from that work, it was very interesting to see the gaps, to see the youth we were actually reaching, and were those the youth that we were really trying to reach to make maximum impact on suicide prevention. So we had a whole group of individuals there. It's actually on 2 slides, and it's kind of an eye exercise, and I think we included for the very reason that you could really see the wide-ranging attendance that we had and the wide-ranging support we had with our partners in the community who are standing with us to make these next steps towards a collective impact approach. There were parents there, faith community representatives, school district had many representatives, nonprofits, serving nonprofits, mental health professionals. So it was a really good time to come together just so we could feel a lot more well-versed in the concepts of collective impact, and to kind of step back and, say that we wanted to affirm and strengthen our commitment to this approach to move forward, and to get an idea of the type of resources. We're not the only community that would be, working on a collective impact model. This is a very strong way of working together that many collaboratives are now doing, and there's a whole body of research that we can lean in on to gain some information that will help us. I mean, doing a collaborative is not easy. Running a collaborative, being a member of a collaborative is one of the hardest things you can do, working towards that common mission, and we really feel like using the collective impact approach and the resources, the knowledge resources it brings to Palo Alto will be incredibly useful. So I'd like to end by talking a little bit about the recommendations. So the two consultants met with us that day, and they had a chance to also meet with City Manager Keene. The superintendent was also able to get briefed on the work that day. He was in attendance that day as well, and Brenda spent some good time with him, briefing him on the results of that meeting. And they sent us some recommendations, and you'll see those on page 7 and 8 of your staff packet. So I won't go over them individually, but we feel like that our transition to a collective impact model will be a journey, and the Project Safety Net Collaborative members will work on that. We admit we don't have all the steps in place, but we would like to share with you tonight what we think are some reasonable year 1 goals. So I'd like to quickly go over those, and I think spend the rest of the time hearing your questions and comments, and really being able to give that time back to you. So the first step and the first recommendation for next year is to contract for an interim or transitional Project Safety Net leader For PSN to be successful, what we heard over and over and over again is we needed someone whose full-time job it was every day to come to work on collaborative issues. And as you know, that's something we haven't had in the last couple years, and it has been a real gap. The second thing we feel is a workable year one goal is to complete a Project Safety Net collective impact roadmap. Rob kind of quickly laid out what a roadmap is, but we need to establish the roadmap for Palo Alto. And we feel like that's a reasonable year one goal, to create one that is plausible, testable, and doable. The third one is to establish an executive board made up of key institutional leaders. And this was a, a recommendation from the two consultants, really feeling like this executive board with its two founding members, which would be Jim Keene and Dr. Max McGee at the school district, would be able to call together other strategic leaders in the community, leaders of key institutions, and bring them together to talk about marshaling resources for Project Safety Net. Excuse me. I'm still here.
I was ready to jump in.
Thank you, thank you. The fourth thing that we feel like is a year one reasonable goal is to resource some teams. And these are the key three areas that any collective impact approach and collaborative needs to be successful. And that is to have strong skills and strong resources in data collection, capacity building, and facilitation. So we feel like resourcing teams in each of these areas will be key for our year one. And lastly, and certainly not lastly in importance, is to elevate youth voice. We need to establish an ongoing avenue for authentic youth voice. We have had youth involved in Project Safety Net at meetings. Thank you. We've had Project Safety Net, we've had youth involved in subcommittees, and it proves difficult. It proves difficult for time of day. It proves difficult just to set the youth up for success in those meetings, and really hearing their voice as far as what would be, successful strategies for their involvement and successful strategies for affecting youth in our community. So that is what we'd like to do for next year. And I think if you look back at the youth events that we've had in the last 6 months, I think we're at a good start there. Lastly is the Project Safety Net budget. So this slide represents the city's budget as it relates to Project Safety Net. We are showing a couple things. We're showing the adopted budget for this year, the amended budget. As you know, we came back to council for additional funding for the Track Watch program, and the proposed budget for next year, which Rob will speak to just a little bit. So I just wanted to emphasize that Project Safety Net is a collaborative with over 20 agencies participating. So the budget that you see here is the city's budget for Project Safety Net. And it does not represent the time or the money or the commitment that many of our projects, that all of our partner agencies contribute, and many of them quite substantially in their efforts to work on Project Safety Net goals and outcomes. So I just wanted to share that with you, and Rob will kind of go over a little bit more about the budget.
Yeah, just really quickly on that point, this is really the Project Safety Net budget that is drawing on the Stanford Development Funds for Project Safety Net. We, as a city, do a lot more than this for teens and for youth. That also relates to Project Safety Net work as a partner organization, and so to Mika's point. I did want to call out the track security number. It was overstated by about $170,000 in slide yesterday. That's not to say this isn't still significant. It really is a significant commitment to rail security if we were to fund at that level. So
right.
I think
and I think, if we went down the different partners that are here represented today, each of them could talk about the substantial commitments that their agencies are invested in currently and for next fiscal year as far as their commitment to Project Safety Net as well. So with that, we thank you for your attention to our staff report.
It was long, sorry.
It was long, we're sorry, and we invite any questions.
Well, first, I wouldn't apologize for it. It was a very informative report, and I think really helpful. Thank you. Colleagues, would you like to start off with questions?
Do we have public speakers? Or?
We do.
Sure, I'll start off. And I'm assuming I should, nope, I shouldn't. I have no idea why we have these microphones. Silver. This one, gotcha. Well, first of all, thank you guys very much. Thank you for the staff report, the presentation, the work that you guys, hours and hours of work that you guys put into this. Is this close enough? You know, and have been for years. This is an issue that's been confounding our community for a long time. And we're lucky to have all of you guys who are working on it. A couple of questions that I had were, and I mean, the collective impact model seems to be the right model for the various organizations that we have involved and the expertise that each one brings to specialized areas of the issue of, you know, kind of teen mental health and youth well-being. It reminded me, well, I'll get to that question in a second. But could somebody, and maybe I missed it in the staff report, and I didn't dig too deep into the amendments or the attachments, but I mean, if you had to summarize in 50 words, what's the biggest difference between what we've been trying to do and the collective impact model?
Go ahead.
Maybe you can add what you would say. Maybe can you go back to the slide, Tanya?
I have an initial.
Okay.
So I think there's several. I think a lot of what we're doing is collective impact, really.
Yeah.
I mean, even the word, right? That's what we're doing. We're bringing people together to try and have a collective impact in Palo Alto to support youth and teen well-being. A couple of real differences is the shared measurement. I think that's the big one. We don't do that. We measure in a variety of ways. The school district does probably the most sort of measurement. But we're not sharing that across sectors in a way that informs what we do and where to invest more or less. That's not happening, and so I think that's a really big difference. The second one that I would mention is the backbone support. Mm-hmm. It's been the city of Palo Alto, right? You know, and that on the whole, I think was good to get us started, but I don't think it will work for the future. Mm-hmm. And the collective impact approach suggests that it is an independent organization. Yeah.
That's what I was going to say.
Perfect.
I just wanted to give the visual
back.
back.
I appreciate. Oh no, absolutely. And the visual is very helpful. I just was trying to get the contrasting between the path forward and where we've been. Speaking of the backbone support, so I work in my day job at the Silicon Valley Education Foundation. We're an education nonprofit down in San Jose, and one of our big initiatives, it's not that new, is the Eastside Alliance, which is a collaboration, we call it, between the Eastside Union High School District, the 7 feeder districts, K-8 districts, into the high school district, the community college district, and San Jose State. And then we also bring together kind of outside organizations. And SVEF, we're kind of that backbone support, I think. And we have our VP of Programs and Advocacy, Manny Barbara, kind of runs the initiative. I raise money for the initiative, you know, and it seems to be a pretty good model. We've got support staff within SVEF that can help Manny. What organization do you see playing that role for here?
And that's
considering because we're vetoing a whole bunch of them because we're saying if you're involved at all already, you know, then you shouldn't be the backbone.
And not necessarily. I mean, that's what this says. But I do think we need to, as a collaborative, really think that through because, you know, starting another nonprofit. One thing we have in Palo Alto is a lot of nonprofit partners, mm-hmm. more than most. Mm-hmm. And you know, is it another nonprofit partner? I know even within the collaborative, there's been concern about that. Should we maybe have a fiscal agent? Should it be one of our large medical institutions that has the ability to take on some piece of this, like shared measurement, like Lucille Packard Children's Hospital, Sutter Health, potentially. I think that's something we really do need to think through. We don't have the answer to it yet.
Right, and I think, working with the two experts, looking at the consultants, looking at the models that they have used and overlaying that to Palo Alto, see that would work. I've initialized some conversations with the Silicon Valley Council of Nonprofits. I'm going to have a conversation this week with their executive director to get some ideas from her of what's worked for other collaborative effort, what hasn't worked. And I also had an initial conversation with someone with the Silicon Valley Community Foundation yesterday.
Great.
And he'll be putting me through to his supervisor as well. So we're going to look at different models. We haven't looked at, landed on a specific one.
Mm-hmm. I guess I'll stick with that and maybe see if I have other questions.
Okay.
Corey?
Well, actually,
Thank you.
my only question really is actually to follow up on that. My initial understanding was that the idea here was to move in the direction of establishing PSN as its own independent backbone organization. So perhaps I misunderstood that. I thought the idea was that you set up the executive board, you hire a director. I thought the idea was to move PSN into the direction of being really its own backbone rather than finding some other, perhaps I misunderstood it. After Mark's question, the responses, I'm more confused than when I came in.
That is the sort of typical collective impact approach. But as other organizations set these up, there's different varieties. And maybe Leaf can speak a little bit to the one that's in East Palo Alto. I think they use one of the smallest, if this is right, one of the smaller.
Terry's.
Was that Terry's?
That's Terry's.
I think one of the smallest partners that is the backbone and can provide that particular service. It's just something that we really need to think through. Creating a nonprofit is certainly one of the leading thoughts on this. But I have to say, it's not where everybody's at. Not everybody in the collaborative thinks that that's what we should do. We should take our time and really think that through.
So if we this evening, for instance, approve the staff recommendation, and full council, assuming hypothetically goes along with that as well, then what's our roadmap and timeline for deciding on what the backbone organization would be?
It's this first year. It's part of that first year work plans, hiring that director and working through what are the options for a backbone agency? Does a nonprofit make sense? Do we want, I think it also the discussion with the senior leaders of the institutions that are here in Palo Alto, such as Jim and Max and some of these higher level folks, to think through what their interest is. They may step forward and say, we want to do that. Stanford University may say, they've been interested in this work and are following it closely, may say, as a teaching hospital, we want to be we'll be the backbone for you. We have researchers on staff, we can do that. So that's why, we're just not 100% saying it's going to be a new nonprofit partner, that's...
Okay, so again, if we were to go with the staff recommendation, both as a committee and as a full council, would then the interim director, would one of their roles be facilitating the decision-making about the future structure of the organization?
Yes.
And the future selection and solidification of a backbone agency?
Correct. Not on their own. With
they would be
with the
facilitating
collaborative
that conversation.
And as the city, if we're funding it, there will need to be a check-in with either this committee or the full council, probably both, before the decision is made.
Great. Yeah, I would certainly not expect them to just make the decision, but they would. One of their goals or responsibilities would be that selection.
What are the pros and cons?
Helping again facilitate the decision making so that we can have some closure on that question and move on with getting the work done.
Yes, interesting. We talked about the 5 cities, Daly and Dutton, from the East Coast, and they had a really large community crisis and suicide cluster there, and they developed a Communities That Care model is what they used, and it began in the school district, and that was the backbone agency. And then I think at one point it was with the Y, and eventually they developed their own nonprofit because they grew, and it just became that was what was needed for them. So it's not uncommon that it, that it evolves.
Okay. Yeah, that's it for my questions. I have comments, but I'll save them until after.
Well, let me follow on to Corey's before turning over to Tom, and then I have some others after that, but on this particular subject. So, is it correct that we really have two aspects to this collective impact discussion? One is the model for the organization, and the second is who serves as the backbone, and that we're talking about proceeding with a model for the organization at this time,
Yes.
and giving ourselves some breathing space to determine this second backbone issue as we go forward over the next year or so.
That's a great way of saying
Could I just deepen that just a little bit? I think that's exactly right.
Yep.
I think it's a little more though, like apologize for a sports analogy, but the chair is a football player, et cetera, is running the...
Not anymore, Jim.
Your dad was a coach, of course. We're sort of running the wishbone type offense here in the sense that settle on the structure, then deploy the structure with the concept of, one, taking our time, but actually maybe testing it out, even with an interim director. There's always the potential the interim director could morph into the permanent, for example. But obviously we have enough pressure on us to get things moving and take us to the next level that this is sort of an acknowledged evolutionary model that will require a kind of rigorous assessment of how things are unfolding as we go ahead to make sure we make the right choices, right? So we don't get soft-headed about whether we're on the right track as we're testing this or not. So I think the other thing that I wanted to add about what's different about this is it's more like we're re-energizing, giving a boost to the existing project safety net, because I think the executive board, for example, is going to have to be really invested also, because there are some real decisions and considerations that are going to have to be made as the year goes ahead. We can't just sort of say, oh good, we've got somebody, a director on board, and we'll sort of see what they say.
So, I haven't been deeply involved in Project Safety Net, so I may have some very basic questions if you guys could fill me in a little bit. But in terms of the model, I guess what other models were actually considered? Or was this really the primary model you looked at?
Yeah, list of models.
I know, I'm looking for that. Well, the four kind of models that we brought to the subcommittee were looking at having no project safety net staff, that it would be volunteer-led, and there'd be shared leadership among the partners. So that was one thing that the subcommittee talked about. We talked about just leaving it as the current model, that the city of Palo Alto would hire and manage the staff. Mm-hmm. We talked about another project safety net partner, not the city, becoming the sponsor partner that hires the staff with financial support from other partners. And then we talked about enlisting a separate organization specifically designed and purposed to provide resources and infrastructure for the collaborative. So those were the four concepts that were discussed. And I think we all came to the deep realization, we were just talking about a backbone agency. This work of collective impact of the shared model, I think that was exciting to everybody, but the work that really called us together was to look for the best concept of a backbone agency that could push PSN forward. I'm not sure, Leaf, did you wanted to add something? You were at those meetings as well.
I think it was
You
very...
hit that button, make sure you're on. I'm not sure if you're great.
The process was a very practical one of understanding what had worked and hadn't worked in the past, and what were the potential ways to fix those problems. That we had good people around the table, but there were structural issues why we were not being successful moving forward.
Okay. And I was looking, I didn't see it. What are the organizations that are part of Project Safety Net, and is there any criteria to be a member?
A willingness to work together working towards very important work.
And you don't, if you don't, you can just tell me where to find the list.
Right, it would be on the Project Safety Net website. I think if you go back and you look at the people that were at the workshop on May 7th, that's really our partners. You know, working with staff at, Palo Medical Foundation, the school district,
It's like
the Board of Ed. It's really the Y, ACS, YCS, independent mental health professionals. The County of Santa Clara suicide prevention staff has been a great asset to us.
Is the JCC and any other religious organizations part of this?
Communities there. There's
Yes.
several faith community members that come. The JCC was involved early on. But have not been attending recently to the meetings. But to your point, Councilmember Du Bois, is a good one. Our thinking, at least definitely my thinking, I think the leadership team is that everyone really in the community that cares about young people is part of the safety net. And
so if you show up, you're in?
You're in. Yeah, no, really.
Okay.
And so what we're
Rob says if you live and breathe, you're on the
yeah, it's true, because everyone has an
role
impact
to play.
on a young person, right? Whether they're living on your street or you're a teacher or you're whatever.
So then when you start to talk about shared measurement and accountability, what is that going to look like for member organizations if you kind of show up and you're in? I mean, how accountable do you have to be?
Right, I think maybe Leaf, do you want to speak to that a little bit of how your coalition does it? Because there's sometimes different levels of expectation and involvement as a key organization or a member organization or a participating organization.
So in our collective impact,
your mic, thanks.
In our collective impact experience in the East Palo Alto community, East Palo Alto and Bellhaven, the collective impact organization is called YES, Youth Empowerment Strategies for Success, and the backbone organization is the One East Palo Alto organization, Neighborhood Improvement Initiative, and that was originally a convening organization, so it's an independent, neutral. Those of us who are involved in direct service with young people rely on them as a support. So that organization is held together by MOU agreements. And our shared measurement is done by the Stanford John Gardner Center. So this is Sequoia School District, the Ravenswood School District, and 44 nonprofit organizations.
If I could interrupt, just so like in an MOU, they would commit to certain resources or certain participation.
And the key one is that we provide data on the students, the names and the attendance of students participating in the after-school organizations. That's then securely compared with the data that school districts provide. So they can identify if someone is involved in 2 after-school programs, does that increase their likelihood of graduating or of grades going up? So, and they also can identify gaps. So this is where the rubber hits the road in terms of knowing if we're being effective or not. What sectors of the youth community are we leaving out? Are we not serving Pacific Islander kids in the way that we should? So that all is we would never have a way of finding those things out without the Stanford John Gardner Center with the MOU agreements. And we can't join the organization as a member, we nonprofits, unless we agree to submit our data.
Okay.
And with the assurance that it's protected, it's confidential, and it's aggregate reports that come out.
Right.
So that's the way we work.
So that's kind of another prime role of this backbone organization is data integrity and security.
Absolutely.
Okay. Quick question on the gatekeeper training. Does that only occur in high school, or are we doing anything in the middle schools?
Just this year, we started piloting the QPR in the middle schools, and that's something that has gone really well. And so we want to continue to offer that to our middle school students.
Great.
Did you do the staff at the middle schools as well, though?
Oh, staff at middle and high school have been trained ongoing, for sure.
Yeah.
We don't have the middle schooler part worked out yet. That's really not been done on a national level. The QPR folks look to us in some ways to try and develop what is the practice for reaching younger kids. I'll be totally honest, we have struggled a little bit with QPR as the main gatekeeper training for teens because of the infrastructure needed to do that properly, to connect with teens. We have a number of people from Santa Clara County who are well-meaning and trained, but they've not been in a classroom with teenagers. And so we have actually looked at some other models for gatekeeping. We're going to continue to do this for adults. QPR, gatekeeper for adults, is going to continue. But unless we continue to train teens to support one another and to go to trusted adults, the big data nationally show that just doing gatekeeper training for adults does not lead to the youth help-seeking behaviors changing to go to adults. So you have to empower the youth in a very direct way, either through QPR or another program. Sources of Strength is one example, does leave out, it doesn't capture all of our secondary school kids because we have the 2 high schools and then we don't have the middle schools. We don't have Castellet and some of the others covered. So, but it's something that is an ongoing conversation around what is the best practice, what are the data points that really show is this effective or not. We know that QPR is an effective, proven program of gatekeeping for adults, but it's not enough. You have to make sure you're getting to your other constituency, which is the youth themselves.
Okay. So I saw the mission is kind of promoting youth well-being and suicide prevention. How much does the focus continue to be on kind of the youth well-being part? It seems like, again, you're talking about like Stanford Medical, that seems very heavy on the suicide prevention side, if I'm reading that right. You guys have comments on that?
It's an interesting question, a good one, because it's been a little bit of a challenge, I guess, for the collaborative. We've worked hard to keep both in focus. Suicide prevention, very much downstream, sort of the gatekeeper work, working with medical professionals, and there's definitely lots of work happening there. But also the youth well-being, there's lots of people in the collaborative, like YCS and the YMCA, the JCC would fall into this. The city programs and our art programs are very much upstream youth well-being. So we've kept them all together. Where is the emphasis and resources? It probably changes from time to time. Right now, with the most recent incidents and deaths we've had, very tragic. So maybe more emphasis on the mental health piece. But we've kept both at the table, and intentionally so. And this has been a discussion the collaborative has had, the leadership team and the big collaborative. Should we be more focused on one versus the other? And we've always ended up with, no, really, we need to focus on both.
Right, I think we found a real strength from having all those voices in the room together.
To me, it seems like that's a good thing, and again, that would be a big factor, I think, in choosing that backbone organization, because you could potentially really slant it one way or the other.
Right.
And again, not to overemphasize this, but thinking about teens, I wonder if there is a bigger role for kind of youth group organizations generally, and if they did sign those MOUs, it might be another interesting data point of kids who participate in a youth group. It's an organization outside of the school.
Great idea.
And so much of this seems to be focused around the school.
Right, there's so many other avenues where youth come together with it. It's a faith community, it's a sports community, and we really know that we have extra work to do in that regards to hear all youth voices.
So it just seems like a good one where you have an adult leader and it's separate from the school.
Exactly.
So I'm going to channel the ghost of Larry Klein a little bit and switch to a little bit of a discussion on the funding side. So looking at the minutes from last October, it seems like, if I'm reading it right, it seems like there was a big kind of shift in funding, because they were talking about $75K, $100K, basically running on the interest from the $2 million, and talking about those funds lasting for 20 years. And then, the actual stated budget for last year was $214K. Were there monies in there coming from other sources, or when did it shift from October till now?
This is a good. Jim may want to talk about this. And then project safety net's one thing, and holding the collaborative together, making sure we're aligned and those things. And then there's track security and track watch, which is definitely related to project safety net, but it's a pretty unique effort. And that's what's really pushed the funding up. We have right now track guards around the clock at 4 locations, plus a floating guard to support breaks. That's what's pushing it, Jim.
Yeah, well, let me, I mean, you're sort of speaking at the micro level about what we have, but I think that going back to October, I mean, one, we were sort of on the other side of the reemergence of the cluster for the most part.
That's correct.
We were also having a larger conversation that wasn't just about Project Safety Net, but it was really about the use of the Stanford funds, the $4 million health and safety funds, of which $2 million have been allocated to Project Safety Net. And we had a whole series of other folks coming to the policy, I think it was policy and services meetings, you know, who were sort of making the case for how the remaining $2 million might be used. And so there were a lot of different kind of ideas out there. And I think a lot of the committee's concern, and as I recall it, say, for example, Councilmember Klein and others, was on the constraints on the funding that we have. Hey, if it's $2 million or if it's $4 million, we still don't have a lot of money to start making decisions. And they almost sort of shifted to an idea that we had proposed early on that I think the council hadn't sort of seized on, which was, do we try to start to look at these limited Stanford funds almost as an endowment and just try to keep it and use the earnings to fund things. That was really what was informing that sort of $75,000
that's what I thought.
Yeah.
And so I guess question is what happened between that discussion and, you know, spending $214K in last year, and then so since that idea has been totally lost, I just wondered if that's been discussed or.
Yeah, no, it hasn't really, and I think, I mean, as far as where we were, and let me just sort of set the stage again, also for where we were back in October. I think in addition to the discussion about what funds we have for health and safety in the community, of which the Project Safety Net initiative with its two components, youth well-being and suicide prevention, was one stream, so to speak. We were pretty disorganized, I think, in October about where we might be going with Project Safety Net. I think it was very difficult for the committee and others to sort of understand what the choices would be, and so there was a hesitancy to make any decisions really about what we're doing, and we had this directive to come back and do the work that has been done here. And since I'm speaking, I would just say I think there's been an incredible advance from where we were then, which is, you know, cloudy and confusing, to really a lot of clarity about a path and a viable structure. But a lot of the issues that we had at the very beginning of the first forming of Project Safety Net are still here with us. We have a crisis. We put together a collaborative. It sort of defaults to the city as a hub because nobody else could be the hub. We sort of were providing the main funding sources, but all along in the background there's been, how do we make this sustainable? How do we shift the roles? And so there's, even on the city side, and everybody else, has been a concern about, well, what's it going to cost? Who's going to do what? And that had sort of moderated a little bit, and we were just having this discussion where it was easier to say, let's just maybe put $75,000, and then bam, not only have we sort of lost the staffing and Project Safety Net, but we've got the cluster emergent again, and so we're almost back in triage in crisis, which is why we're suddenly spending so much money. But we still all have to acknowledge that while we've got to be in triage, we've got to move to health simultaneously with that, not just in the community, but in the way we're working these things. And so pretty quickly, I don't know what the numbers are, but you know, with $700,000 this year and $400,000 and whatever we've spent, we're at least $1.5+ million out of the existing $2 million. So
we have 2 years.
We've got to confront this issue head on about where we are, and that's why we've got to have a really more, I think, more potent collaborative with requirements, it can't just be on the executive director to carry all of this, but that person has got to be skillful enough to not only engage stakeholders, but whatever this executive board is, in my way, to say, we've got to invest, we have to make difficult choices, and we've got to do it in a timely way. And we've never really had that. I mean, we've been a confederacy of sorts with.
So, I mean, again, I don't know the right numbers. I'll just throw out there. I am a little concerned about the 38K figure. Yeah, it's not a lot of runway. If you bring in a director, what are they supposed to shift to fundraising immediately? Are there grants and things we need to go after? But even that doesn't seem like a lot of time. And so what's the sustainable model? It doesn't seem like there is one right now.
You're right.
Okay.
But I will say that we've always said that what we're doing and what we're funding is really seed money. It's more than a Kickstarter program, but we've got to move to a sustainable model. And I mean, Max and I have talked about, for example, the fact that, and sorry, from my point of view, the school district has to find a way to fund this in an ongoing way also. Yeah. And there may be other community decisions we have to make about how we fund it in an ongoing way.
And I guess if you look at the track watch dollars, you could, in a sense, take them out. They're really just allocated to track watch, and they're just here because that's where the funding is.
Very good point.
Yeah. So, okay.
Sometimes it's, you have to build it before the money shows up in some ways. I mean, to have the map and have that person hired and have a compelling story, and then funding will become available. I believe it will around a topic like this.
Yeah. It's just if you start with a really high cash flow, it's hard to go down, right? And so you're kind of locked in. So I'll stop there. But thank you guys for.
So I'd like to follow on both Tom's comments, and then to a good degree Tom and Mark were really trying to draw out the distinctions between the program that we had started with, which was a collaborative of sorts, and this more focused collective impact, and what's really similar and what's different. But let me go to this last topic that Tom touched on at the end, which is we have Track Watch described as being part of Project Safety Net.
Yeah.
Are you envisioning that the executive director would oversee Track Watch?
No, it's being shifted to our public safety staff, and that's where it belongs. But how it gets funded is still, a question right now. It's being drawn from the Project Safety Net, $2 million. That could change, I guess, but it has to come from somewhere. So,
okay, so that seems really logical. And where are we in transferring oversight of Track Watch to the Public Safety Department?
I think we're a month in.
Yes,
So it's already occurred.
Yes, it's been.
So is it? And I understand that at the beginning we had a volunteer program of Track Watch that then became we hired as a city, and that was supplemented by actually our own police officers out there working with the volunteers, and then we hired a private entity, and somehow it seems that because at the beginning it was a volunteer and it was somewhat orphaned, it was spontaneous and orphaned, that it got overseen by Project Safety Net. But as Rob, you're saying now, as of already, it's essentially not part of Project Safety Net. It's a public safety endeavor overseen by our public safety department, with certainly a involvement of those entities that are focused on youth well-being and the objectives of Project Safety Net. I think it might be more clear that the sooner the better we segregate those two things, and that the funding is recognized as a public safety expenditure, and it's not a mental health function, it's not a youth well-being and that broader upstream. It's about public safety and security at tracks. And I think we're confusing this whole thing, and gee, the project safety net budget is blown up. Well, no, look at where the dollars are. We have a much smaller, more focused discussion around the true purposes of project safety net. It just, the track watch didn't have until just now a real assigned and properly assigned overseer of that. It was being taken up slack by people who stepped forward and said, it needs somebody to take up the slack, and it was done. So I think that's something that maybe we should discuss when we come back to discussion.
Councilor Burt, Chair Burt. Only thing I would add to that is that the track security, what is in the project safety net plan as what it's called means restriction, and Shashank is better can talk about this more, but it is part of a suicide prevention plan, not always related to tracks, but for us it's very much related to track security, and so it is part of the project safety net.
So I appreciate that, and that's what I was trying to allude to in that last part of that there would be an involvement, just like as we do capital investments on our track. Is that a project safety net responsibility and oversight, or is that something that is led by Public Works with a collaboration by our Public Safety Department and by our Community Services and Project Safety Net? I don't see the executive director of Project Safety Net getting involved in the engineering design of how to obtain track security. So I think we've kind of drifted into something that we should take a step back and say, okay, there are certain other functions where clearly we're not siloing this. We're not saying it's only police department, or when we do the physical measures, it's only Public Works by any means. But where should it really be overseen and assigned? And for that matter, where should we put it in the budget? And I think it becomes confusing when we were first looking at the Stanford funds. We weren't talking about paying for ongoing track watch out of the Stanford funds. And that's, what, 2/3 or more of this whole budget. So I think we've kind of allowed a drift to occur, and by everybody just saying, well, we've just got to do it, that's entirely correct. And you know that I've been someone, as we've talked about the enormous cost of the track watch, a question that we have to ask ourselves, despite its enormous cost, is what price are we willing to place on the life of a single child? And that becomes, as expensive as that is, an easier question to answer as to whether we must do it. If that's the way that we have the most effective prevention measure right now, it really doesn't become much of a choice, because I don't see the ability to make an argument that we should not spend those dollars and in exchange lose the life of one or more children. But that doesn't mean it should necessarily be the responsibility, the lead responsibility and the management responsibility of Project Safety Net. Those are two different issues.
Well, if I just might add to that, I mean, sort of to invert that, Project Safety Net being both suicide prevention and youth well-being, we have millions and millions of dollars that are being spent by public agencies and in service provision and hospitals outside of Project Safety Net. We're not all bundling all of that into it and saying, oh, this is Project Safety Net.
Yeah.
As far as the budget and that sort of thing.
And I would just say, based on this conversation we had today, is Claudia here?
Yes.
So was it you who talked about public health today? Somebody talked about
Pat.
You might want to mention what you're talking about.
Pat,
And Pat wasn't introduced.
Can I just invite Patricia Lau to speak again as eloquently as she did today at the media roundtable that unfortunately none of our local media attended. This will be the first of 2 media roundtables. There'll be another one in September. But on the bright side, we did have some agencies that really did need a refresher. One of the agencies was actually one of the panelists. We had a little bit of a healthy debate about the merits or not of running a story about a community meeting that we might have in Palo Alto, and how could they not run a cover with a picture of the train if that's what it's about. So we had a spirited, I would say, discussion where I tried to really highlight the research on why that's a really bad idea, not just because I say so, but because here's a really well done study by the leading suicide epidemiologist in the world that says that's not a good idea. That's an example of something of how you don't cover. So I thought it was a very good discussion, but I liked, Patricia, how you couched a lot of this work in terms of public safety, and maybe that's what council members Bert DeBoer or maybe Pat in particular were referring to about the public safety piece.
Good evening. My name is Patricia Lau. I've lived in Palo Alto since 2009. My husband is a surgeon at Stanford, and throughout his medical education, we've lived in 5 different states. And previously, I worked in Indiana for the Indiana University School of Medicine on a project that looked at data collection regarding firearm injuries and fatalities, and it's called the National Violent Death Reporting System, and it's used now as a national database. And so when I came here, I saw the different issues related to the trains and the suicides, and so I stepped forward in October, and I met with Minka, and I reached out and said I would like to help. And so what I said today, and I'm a consultant now with the city, and my focus areas are data collection, means restriction, and some other special projects. But what I'd like to say is that this is a public health project. This is really something that we need to approach from the individual, the family, and the community. And in terms of Caltrain and the media roundtable today, there are people coming together with different missions. But what we need to focus on is the health and safety of our community. Even though Caltrain has its mission of focusing on transporting people safely, I think it's really important for all of us to understand that that train comes through our community, and therefore it is a mechanism of suicides for some of our citizens, not just young people, but also elderly people have been affected. So in going into this, I've looked at a lot of different collaborative efforts, and they're very successful in terms of the backbone agencies. The directorship has to be someone who can understand a lot about the different areas that we're talking about here, and funding. I think that's really important. So going forward, I would just like to emphasize the need to focus on public health and data collection efforts, uniform data collection efforts, whether it be from the hospital, the coroner, the police. Everyone should be able to term whatever they're talking about in similar terms, and that is, I think, was one of the gaps. We were not talking in the same language, and we weren't writing reports in the same language, so we couldn't evaluate. So another piece of this is evaluation. And the last thing I would like to say is seed money, and that's really important to have the seed money, but you want this to be long-term. This is going to be an issue, I think, that's going to be with us for a while. And we don't want to look at these clusters and be reactionary, but rather be preventative in the future.
Thank you. There was a question that Tom had about kind of the criteria for membership in PSN. And I think that was an important question. I think he would benefit from maybe a little more understanding of the original commitment. And then what we really had was some drifting away from that commitment. And we had MOUs, correct?
We did.
Yeah. And so the original partner agencies and entities all had MOUs. And the city acted as both a convening organization and we were a hybrid, I guess, between a collaborative and a city staff doing certain functions. And that starts making some of the distinctions between the model of the collective impact, where the staff is proposing that we're heading, and where we were. We were somewhat, if I understand it right, a hybrid. Mm-hmm. We had many elements of a collaborative, which is really this collective impact I would describe as a deeper collaborative. Mm-hmm. Yes. And what I think we not only drifted away from some of those things that we did in the first maybe 2 years, but it's a deeper commitment to the form and a different leadership. So do we have that slide that had the 5 components of collective impact? Because you went through them, but I think it's kind of dwelling on those that is what people are struggling to try and understand, that distinction. And you talked about the first one being a common agenda. And we did have, to a good degree, a common agenda from the outset. And Rob showed the original Project Safety Net plan. It's a long plan, but I encourage everybody here to take the time to read it. It's really, if you look at it today, it is a very thoroughly designed plan with a lot of still extremely relevant components to it. And I think that there was a temptation to, in the last year, as we lost focus on some of where we were in the first year or two, to think that we didn't have a right plan. And if you read the plan, you go, well, what's not right about this? And there's certainly some things that we would update, but it's a very strong plan. And it was well researched from the outset, and I have no doubt that we will improve that even more as we go forward in collective impact. And then the second, so that plan created that common agenda. And the second one is about this shared measurement. And that's I think one of the biggest distinctions between where we were, because we had a plan, but it was less strong on shared measurement than we intend to have if we go with the collective impact. And then these mutually reinforcing activities, I recall there were a lot of them. But I think, once again, the collective impact model is a deeper commitment to all of those entities coming together and making sure that their efforts are well aligned, which would then show up in those measurements of success. But they don't just happen, they happen because of that common agenda and those mutually reinforcing activities. And then to make that happen was this element of continuous communication. And we had really strong communication in those first couple years. And that is one of the things that seemed to have drifted away and would be stronger. And then finally, this backbone part, and that's where we're looking at something that is a slightly different focus. But I do think we need to understand the difference between what entity or entities are funding versus where the backbone lies. And we could have a shared funding, and we could place it under the city or the school district or a third entity. And those are two different issues. They're not one and the same. And the funding doesn't necessarily flow to where the backbone resides. And so I just want to make sure that we're not lumping the two together. And then I guess, and I apologize for drifting into some comments, but I just am because of the questions raised and kind of, I think that there are some important things that were brought up. The leadership that we're looking at now under the staff proposal is one where it's, and as Rob described it, it's having those collective impact skills and experience and a full commitment to the collaborative approach and style. Right. You had down facilitation too, which is, that's a skill set, but it's not, I wouldn't say it's limited to a facilitation. It's understanding how do you bring together 20 different partners and pull them together rowing in the same direction, even while each has distinctive functions or in some areas more common than others, and they come together in certain elements of a plan, and other groups come together in others. And that leadership is not what we have in a hierarchical structure. So it's a different approach, but it has to be a strong leadership and a non-hierarchical leadership at the same time. That's
why
that's tough.
I've heard it referred to as leading from the edge. And
And they have to be able to address a very unique community, a highly intellectual community who likes to advocate, but also those folks who are underrepresented. So it's going to take a very special person to address all those different populations in a very sensitive way, but an effective way.
And that final part is this roadmap, which is how do we take those 5 elements and put them together in a plan that is not a document, but it is a working, active plan that really guides us to achievement.
May I do this, Pat? So I thank you for that. I think that's spot on. I think that where we are right now is with the collective impact model. I think we have a viable model and structure to use. That said, structure is just a beginning point. So this is like we are reforming, okay, and I'm using this word specifically, we are reforming Project Safety Net. And then we've got to do the same old forming, norming, performing. So all of this work about making sure we have the right people in the place, not just the executive director, but we have the norms of expectations, the need for explicit commitments, and formal agreements, the norms of identifying the measurements that are going to be used, the common measurements. But I think something that's not up there that when I heard Pat starting to touch on, and when Pat was talking about this public health thing, we consciously need to develop the accurate but accessible narrative about what this is all about in a compelling way, so that it's a story about what's happening in the community, so that anybody you don't have to be an expert on this to start to understand how to access what's happening. We're not going to get fundraisers and people engage if the narrative about what we're really trying to do and why we kind of need to keep it going is important. And particularly, the goal will be to put the crisis in the rearview mirror again, but sustaining the well-being piece, that gets to be a challenge. I mean, Chekhov once wrote, he said, anybody can face a crisis. It's this day-to-day living that wears you out. And this is the thing, is how do you sustain this commitment, year after year in a meaningful way?
And I think Jim really touched on that the more we have this strong program, the more we'll be able to draw in even more of the community as human resources and funding resources to fulfill it. And it's just a virtuous cycle that can occur.
Exactly.
Yeah. Brenda, do you have something? No.
Yeah, I just wanted to add to what you said. I think that it sort of points to other comments that have been made as well around who can join Project Safety Net. And I think right now we have many different people, individuals who walk in that are parents, individuals who are part of an organization, but they don't really represent that organization at a level where they can make commitments and decisions. They're there because they care and they might be doing the work. And so I think that the idea of having the executive board that we talked about initially is really important, because we need the decision makers also at the table making really critical decisions about resources and support and outreach. And I think moving those conversations away from just being a city, I think right now it's perceived as a city school problem and not a public health issue, I think will really be helpful for us in many ways moving forward.
Well, and I think also, and I alluded to the human resources, that part of what we need to build is the capacity to take advantage of these people who are basically calling out saying, I want to help, and much needs to be done, and we haven't had the systematic way to pull them in. Many of them have gotten involved, many of them are already involved in different organizations, but it really needs to be systematic. And you know, when you spoke about the initiative in Camden, Maine, if anything, probably the greatest takeaway that I got from when Delane spoke is how much their entire community just rallied around fully participating in the issue. Okay, so we've had public speakers, although some of them are amongst our guests here, but let's go ahead and go to members of the public. Our first speaker is Ken Horowitz. Ken?
Oh, yeah. Okay.
Watch your head when you get up.
Yeah.
Careful there.
Yeah. Thank you very much. I'm Ken Horowitz. I live in Palo Alto.
I guess we'll go ahead and use that mic if it's okay.
Sure. I'm here to support the project that's being proposed tonight. I just want to make a couple of comments. I'm on the Health Advisory Commission for the county as well. And so this issue here is not just unique to Palo Alto, it's all over the county. We have a unique situation because we got a train running through, but kids are trying to commit suicide all throughout the county. I was talking to Hillary Freeman the other day. Hillary used to be on the council, and she teaches in Saratoga, and she has kids in her classroom that are literally cutting themselves, so because of the stress of schools. So I just wanted to applaud the group for all the work they've been doing. And I also teach health education, and I'd like to see more health education going on in the schools. We have, just in Palo Alto High School, we have a 5-unit class in living skills, and a lot of the kids take it in their senior year when they're ready to graduate. And this is something that should be throughout the curriculum, in the elementary schools, in the middle schools, and as well as in the high schools. And just this one class in living skills is not doing it enough. As I said, I teach health education. You'd be shocked to see how little kids know about health today, and particularly how to deal with stress. Thank you for your time.
Thank you. Oh, I don't know how to clear this thing, but there we go. Our next speaker is Pam Garfield.
Push the, you can use the mic on the table, just push the, push the.
I hadn't prepared a whole speech, but I just wanted to just say how much I support this effort, and I've been on the front lines at Glenn High School for the last 2 years, and being a part of this collaborative has been invaluable, both like in a concrete way to be able to connect resources and physically like bring a kid to Dr. Yoshi and say, this kid's suicidal, get him in now. So, very specific concrete things have happened in addition to just the kind of the camaraderie that we've had this year. And that's sort of an intangible that's not in the plan, but has really made a difference through all of the stress and through all this effort. So I really hope we can keep this going. So.
Thank you. And Leif, do you have additional comments?
I've spoken already.
Okay, thanks, but feel free. And Sue?
you want me to turn this on?
Yeah, and just restate your name, just so it gets
Okay,
on the
great.
record.
Hi, I'm Sue Eldridge. I'm a parent of a recently graduated fifth grader here in Park. Big deal. For her and for me. And I have been watching Project Safety Net unfold for the past years. And I'm here to say that I really think the direction that Project Safety Net is proposing is very helpful and can really lift and elevate the work that's been done. Embracing, this has been said before, but embracing collective impact, I think one of the most important elements is that this is a movement. You know, it's a naming of work that's been going on for years and years, but it's a movement, an international movement. And there are learnings, there are bodies that are collecting learnings and pushing the envelope in terms of everybody's understanding of how to do this very complicated work. So aligning with collective impact, I think, can, you know, inform what we're doing here in Palo Alto in a lot of important ways. I got involved most recently, really pushing for this notion of a roadmap as essential to guide a complex effort like this. And Jim Connell is a past colleague of mine who I introduced to Robin Macon, with the intention that, you know, in a very quick, brief kind of series of meetings, he might help everybody understand how a roadmap linked to data could really elevate the work here. And I was incredibly fortunate to be able to help pull together the May meetings. And what that did was just really give me a much deeper understanding of the work that Project Safety Net has been doing and the people involved. And I have to say, the biggest asset Project Safety Net has are the people who are at the table. I can't say enough about how each and every person I met and worked with, you know, the care, the commitment, and the return to sit at the table through what's been, you know, just a devastating period. So, and frustrations and missteps and all of the rest of it, and just incredible commitment. So I think that's the biggest asset and hope moving forward beyond all the other pieces that are being proposed. I want to just reiterate the importance of a roadmap. Jim, you were talking about a narrative. A good roadmap isn't a voluminous document. It's a visual roadmap that can communicate to everybody clearly and simply, you know, where you're headed, but most importantly, what things you want to change. What are those outcomes that you want to move? And, you know, as important as the 41 assets are, it's not going to be 41 assets. And it probably won't be a document with, you know, 22 strategies. However, it will build on all of that, but in a very communicable, you know, presentation. So I worked for 20 years, primarily in low-income communities, working with institutional leaders and community stakeholders to create a collective agenda to promote youth well-being in roles very similar to Project Safety Net. And in every instance of where we got traction, it was a roadmap that was central to our being able to do our work. Somebody characterized the, you know, I mean, you're going to bring a leader in and you're going to have an executive board, but it's a collaborative, and it's that roadmap that sits in the center of everything you're doing that gives the leadership authority, and authority to negotiate when things are slipping, you know, authority to bring people to the table and help and try to help support a focus of attention. So, and a roadmap is something that's the major piece here is that it's going to bring data into the picture really sharply, and you learn using that data, and a roadmap that's dynamic. So I think that the leadership that's being proposed, a director that really has experience is important, combined with this executive board. I probably don't have to say too much more, but without that, I mean, it's that institutional leaders group that's going to be able to really cut through some of the roadblocks, go out effectively, fundraise, and provide the kind of ongoing, constant backup you need. So the last thing I really want to speak to is data. Data and youth voice. I mean, PSN has been collecting data, but I don't think really effectively using it. So the collection of the data is just the starting point, right? And then it's what you do with it, and it's the conversations. And most of the data, a lot of the data you've been collecting, a big piece of that, not all of it, but is youth voice. You talk about engaging youth. In my experience, the leadership roles are important, but the most effective way to engage youth day in and day out is to hear from them about what their experiences are, bring that back into the room with the adults that work with them, and then open up a conversation about why and what can be done, and enlist youth actively in helping move everything forward. So I can't say enough about how important the data piece is. I have some concern that you've got a budget for a year and there isn't much resource built in for the data component. I don't believe, and in my experience, you can wait an entire year to really start moving that forward. The notion of a data group and a data plan being put in place that so that you really know where you're headed is an important first step, but I don't think that's something that needs to take an entire year. So,
great.
Thanks. Thank you all for your.
So let's Kathleen.
I'm sorry. Thank you so much for letting me jump in here. And I also apologize. I'll be quick because I have to run go get my daughter from Coverly from ballet. So my name is Kathleen Blanchard. I'm a mother of children who have attended the school district here. We've lived here since 2003. My daughter Isabel is entering her senior year at Gunn. She'll be student body president, and very excited to be a part of that community. It's been a good experience, actually. I'm very glad that she made the choice to go there. My daughter Chloe is about to graduate next year. After next year, she's entering her final year at Columbia in New York, I'm grateful for the experience that she also had at Gunn. And as many of you know, my son JP was at Gunn, and he passed away in 2009 in his junior year. And you ask, what's the price of a life of a child? It's priceless, and we know that. But what I wanted to just take this few minutes to say is what I find remarkable is how the community came together. And I've been pretty open about what happened to my son. I do that because I think if we can't talk about a problem, we can't begin to solve it. I've been very struck by the number of people whose lives have been touched by suicide, and you would never know it because they have been unable to speak about it. And it's really been very tragic to me because they carry the sorrow of the loss and then the deep tragedy of the inability to speak about it. But as a community, we not only embrace youth well-being, which is a relatively easy thing to embrace. It's apple pie and all that, but to also embrace suicide prevention is distinct and I think remarkable. And to carry forth for as many years as we have with the level of energy and commitment, again, remarkable. And now we're talking about taking this to the next phase. Amazing. We are actually very, very lucky to be living here amongst such good people, such intelligent people, so very willing to tackle an incredibly hard problem. And I have been asked by people who from outside the community, who wonder why we haven't somehow solved this issue. And I thought, boy, you know, if we could somehow solve this issue, boy, we'd own the world, wouldn't we? But we're trying our best, and we're willing to continue to try our very best. And I just have to applaud all the good people around this table and around this community. And Rob says, and I absolutely agree with him, we are all a part of Project Safety Net. You ask who can join, you're already a member. So again, I thank you all, and I thank the commitment of the school district and the commitment of the city and all the great institutions around us for this commitment. I really think that we have saved many lives, and we will continue to save many lives. And again, what a fantastic place we live. Thank you.
Thanks, Kathleen. Tom?
So on that great note, I'd like to move the staff recommendation.
Second.
Great. Would you like to speak to that?
I don't think I can top what Kathleen just said, and I think we covered it, and it seems like a great recommendation, so I support it.
Board?
We've spent a really good 2 hours on this topic tonight, and I concur with what Tom said. There's much I could say, but
Yeah.
no point.
Mark?
I agree. I think it's been a great substantive conversation, really helpful. And I'm going to support the motion. The one thing that I just encourage you guys to do is keep an open mind as to what type of entity ends up hosting the backbone organization. I was just thinking about it as we were talking, and and a lot of folks around the table know, running a nonprofit is hard. I'm lucky enough that I don't actually run one. But you've got HR, finance, development, IT, communications, administrative support, facilities, graphic design. And so, in terms of getting the biggest bang for our buck, if there's another entity out there that is willing to host us and host this effort, I think that's something that could be a great fit if one exists. And I think the Community Foundation is a great place to start. And if they're not interested, they know every nonprofit in or foundation on the peninsula. So hopefully they'll have good ideas if they're not interested.
And great, thanks. I have one follow-up question, and that is around within our budget and the dollars that we increased on a budgetary standpoint tentatively last night. Do we have dollars that are dedicated for the purpose of being able to do the sort of data analysis that may have been something that is perhaps something that we need to strengthen in this entire endeavor?
Did you want to?
Go ahead.
No, go ahead. If you've got some money squirreled away.
I was just going to say, since it was overstated yesterday in the budget, yes, there is extra. But of course, that was related to track security. But there is not funding set aside for resourcing a data team. That's true.
So I would say this. Yes, exactly that. That being said, we'll know next week even where we sort of end up when we run those numbers. And while there's some significant data work, I don't think that what we would have to staff or support would be out of our reach financially.
Okay, and then maybe when this does come back to the council on the overall city budget, we upped our funding for our resources that were more directly Project Safety Net. If you can refine those thoughts on what is anticipated as the placeholder for the cost of the executive director and what dollars we really need to build in for this other function on enriching what we do with the data that we're already collecting, and perhaps within that what other gaps may exist in data. I know that we have a lot of good data, and the point was made that what we want to do is be able to utilize that data more effectively. Mark?
I think that's a great point, and just one suggestion on that I'm sure you all are already thinking about, but what third-party organizations we can leverage who might volunteer their expertise, and Palantir comes to mind when it comes to data accumulation and analysis, and
Right.
they have a big philanthropic kind of
and security.
Yeah.
Yeah.
I'd be
We don't
hesitant
even know
to-
what they collect.
I'd be hesitant to thrust them, because they're data experts, necessarily thrust them into interpreting this kind of data. I think they're in a different ballgame.
Well,
Yeah,
different pieces. Yeah.
But the second part of the notion of what other resources, either financial or through other skills, outside of the normal group that we might think are already engaged in this kind of issue, what we might tap into is an interesting one.
Mm-hmm, yeah.
Could I just say one final thing on this? Obviously, the council members are speaking directly again about the city's piece of this funding, because that's what we have, you have direct control over. But we do have this, when we've talked about it a bunch tonight, we do have to get to work on how we engage and talk about, again, getting sustainable funding from, other partners and other sources pretty quickly this year, too.
And I would be remiss if I didn't acknowledge that we've always had within this plan a major portion that was dealing with the school climate. And the schools have the children for more awake hours than the community and the parents often do combined. And in the last, I guess, 9 months or so, with new leadership, we have had some really positive changes in adopting programs that are, whether they are precisely the P8 or simply align with the same mindsets on. We've had now moving forward with implementation of the homework policy and the counseling model and start times, and recently mental health resources and the challenge success that when at one of the teen forums, the biggest takeaway to me was the students really glomming on to wanting to have a different definition of success for themselves. And so those and other initiatives that have been going on are really positive, and they very much complement the efforts here and have been extremely important. So I just wanted to acknowledge that. Any other discussion? Yes,
I'd
Pat?
just like to say one final thing about funding. There are state funding sources as well as federal funding sources that might be explored, particularly in terms of the means piece. I spoke with Scott Gabri from the Federal Railroad Administration, and we talked about the potential for grant funding at the federal level. Also, there's regional, again, we're in Region 7 for the FRA. And then there's county funding through Santa Clara County. Mental health grants, education and training grants. There's a number of grant opportunities that need to be explored, and they should be explored immediately because of that bottom line. And if you can do that now, you can get a jump start, at least know what the potential funders are, and include private individuals as well as businesses. This is Silicon Valley.
And we should acknowledge too that so Supervisor Simidian had been reaching out on what role the county might play, and what's happened just was announced in the last week or so is a proposal before the County Board of Supervisors to provide psychiatric teen beds within the county, which has, as he said, it's a void that those outside of this field as professionals are kind of shocked to understand that we had none in our entire county. So that appears to be something that's on a very positive track, and it just shows all these complementary efforts, and that the different partners, and the county has been one of our partners as well, will perform different roles.
Exactly.
But I thought more about that, this notion of that, or is the collective impact metaphor really about, we've had a bunch of rowers, and we're looking at how to move them as a team and move forward most effectively.
Actually, I'm sorry, I do want to let us move on with a busy agenda this evening, and let everybody go and watch their tapes of the Warriors game. But there are just a couple things I want on the record, especially before this goes to the full council. One, picking up with another analogy, and actually, City Manager Keene alluded to it, maybe intentionally or inadvertently when he used the word Confederacy earlier. I think that we're in a moment for Project Safety Net similar. Forgive me as a politics guy. Similar to the United States, when we realized that the Articles of Confederation were not a strong enough plan, were not a strong enough body, and rather than throwing in the towel, doubled down on the commitment, the vision, and the values, and said, we've got to come up with a better structure because the vision and the values are so important. And thus we had the Constitutional Convention and a now very, very stable structure for governance. And I cannot predict, but I can certainly hope and support the effort of Project Safety Net similarly being so successful. And I do, again, want to be on the record, especially in the minutes for other council members who have not been here for this whole discussion and may or may not feel similarly as we do here. First, thank you very much to the city staff and everyone involved in Project Safety Net, but as a member of the council, I particularly wanted to say thank you to members of our staff from our part of the partnership, to Minka, to Rob, for an extraordinary amount of work from the city side for so long on this, to Jim, thank you for your work in leadership and willingness to become even more of a direct leader on the executive committee. And Ed, even though you've not been here long, I hear great things about what you're doing to support the teams that are working under you. So thank you very much. This is a very important project and you have my full support.
It's great, and I would also extend it to Pat, who's doing work for us, and a reminder that at 9:30 tomorrow morning we have our weekly Caltrain safety meeting.
And before the vote, then I will just add the emphasis on the incredible role of the community partners.
Yeah.
All right. Ready for a vote? All in favor?
Aye.
That passes unanimously. Thank you all very much.
Thank you.
Nope. Break?
I think schedule. Yeah, break would be good.
So
But yeah,
let's reconvene, and there's a question on, given the important time that we just spent on the last item, we had item number 3 that was referred to this evening really as a placeholder, should we be able to get to it. And it doesn't look likely that we'll be able to get to it. So on that note, let's go ahead and continue with our agenda, which is, next item is item number 2, which is referral of a colleague's memo regarding strengthening city engagement with neighborhoods.
Thank you. Good evening, Chair Burt, Policy Services Committee members, Cash Lai, Senior Management Analyst with the City Manager's Office. This colleagues memo was brought to the council originally on March 13th, and then forwarded it to the April 20th meeting, which at that meeting it was then referred to the Policy Services Committee. We've brought it forward today. The memorandum seeks to build on existing engagement platforms and add more face-to-face contact with the neighborhood organizations. If I could have you turn to packet page 72. The memo outlines 7 major points. What staff has done is put those bullet points in the staff report and commented on each of the points. Just for the sake of time, I was not going to go through the points and highlight staff's comments. We can if you'd like us to, but I just wanted to just quickly set the context and turn it over to the committee for discussion. I don't know if Assistant City Manager Ed has some other comments.
Let's see, I think we also wanted to note for the committee that we've forwarded a set of community comments that had been received in response to the initial item being brought forward to the council. Let's see, I'm not sure how to refer to this.
That's it's an Outplaces memorandum with a number 2 on it. We received letters from Sherry Furman, who I believe is here, and I don't know if she submitted a card to speak. Brent Baker, Barker, Annette Glankoff, and Fred Balin. They have in their letters commented on the 7 points as well. There are some themes that have come out of those letters that staff could summarize for you, if that helps the discussion.
Why don't you go ahead and address those themes?
From the community members' responses, or for the...
Yeah, and I think it would be useful for you to go through
Sure.
and give the thrust of the staff
No problem.
responses to the elements of the colleagues memo.
Okay, so let's turn to packet page 72. The first bullet point, just to summarize, is about the website, or the City of Palo Alto website, and what information it has. And then it does talk about a process for formally recognizing what it means to be a neighborhood in the government zone. Staff's response is that the website does need a little bit more work. There is some basic information on there. Certainly, we can always do more. And one example is that we have a map of the neighborhoods on the existing website that shows 30 neighborhoods, whereas the memo refers to 37 neighborhoods. So there is that little bit of, we gotta figure out what do we mean and what is the boundaries. With regards to the definition, recognition, there's multiple different approaches for this. There's pros and cons. We'd like to have that conversation with council. I think the community response that we saw in the letters was to really not get involved in that. And I think Sherry and others can speak to that, but it seemed for us to, not as a city, to not really dive into that much.
I'm sorry, can you explain what you're meaning there? You're talking on the facilities, number 2?
No, I'm talking about number 1.
Oh,
bullet
okay.
Point number 1. It says the city should review the process for recognition in consultation with neighborhoods and explore agreement on basic standards and requirements regarding governance, association responsibilities for outreach, and inclusions as a recognized neighborhood association. And so that really trickles down into how are we defining a neighborhood association? Do we want them to have bylaws? Do we not want them to have bylaws? Do we want them to have a board and not a board? Do we want them to have insurance? Do we not want them to have? So it's, are they a registered 501c3? Are they not? So all that opens up a whole set of discussion and pros and cons, and so we can have a conversation about that and determine what the council would like to do and what the best recommendation is. But it seemed to me from reading Sherry's note and Brent and Annette and Fred's that their recommendation was to not really describe what that should be and let the neighborhoods kind of form that on their own.
Well, I see in the staff report that you'd yet like to do research on what other municipalities have done.
Correct.
Were you going to do the research first or draw the conclusion before doing the research?
Well, if we go through the other points, you'll see a couple times we bring up the point of doing a survey. And I think that survey could touch upon a lot of the different points that was in the colleagues' memo. And so, I think it's a combination of both.
And are you talking about a survey of existing neighborhood associations in Palo Alto, a survey of neighboring or similar municipalities, or
the existing neighborhood associations? Yeah. So so I can jump into, like, for example number 2, the recommendation was for recognized neighborhood associations, and the city should explore guidelines and costs for providing periodic free use of available public facilities for public meetings and events, as well as insurance coverage under the city's policy. So for that's where, we'd like a little bit more information from our existing neighborhoods. Does that mean that how many times per year were they wanting it, the duration, what types of events, are they fee events, are they non-fee events, do they want alcohol at the events? So there's a lot of different nuances to what that use means.
If I might also add, perhaps back on the reference to research and the areas that might be researched. I think in our staff report, we wanted to phrase it in terms of if the council, for example, wanted to establish those basic criteria or standards for the components or elements of neighborhood association. That's certainly an area that we'd want to research further. I think the feedback that we did see from the neighborhood associations reflected some concern about going down that path. And so from a staff perspective, I think it'd be fair to say that we wouldn't necessarily need to do the research if, in terms of the council priorities, that were not an area that we wanted to pursue at this time. So that would be one, and perhaps more broadly, this issue of the survey, research, and the like, really something of the elements of just simply trying to get some feedback from the existing neighborhoods and the methods by which the follow-up work that staff were to do would really reflect the interests and the priorities for the council and for the neighborhoods themselves.
Okay.
So, just to follow up on number 2, we have included some of the fee schedules in the staff report if we want to dive in and look at the fees. But as the committee knows, there is a pending item on the committee schedule to come back about the facility rental fees, and so this could also tie into that. The third item was one-time startup grants for the neighborhood associations to be used to attend the United Neighborhoods of Santa Clara County's annual conference towards neighborhood association initiation activities. We do think that some sort of startup or governance training funds for neighborhood associations would be a good investment. Again, we'd want to check in with the neighborhood groups to see what those training funds would be for. Neighborhood associations all are at different evolutionary points, and so the needs of one may be different than the need of another. So we wouldn't want to limit the use of those funds just to this conference or this organization. And we haven't heard back from that specific organization's executive director. And in speaking with community members, some have already attended that, and I think the jury's out on whether that specific organization is the best one to align with or not. So that's the update on number 3. Jumping to packet page 74, number 4 is to support the neighborhood associations in distributing relevant information to members, including information about upcoming community meetings or events, notifications, proposed projects in their neighborhood, city initiatives, emergency preparedness events, county proposals, public works or utility projects, Caltrain's VTA, or neighboring community plans. So we're just a little bit unclear on the direction here. We do have many avenues for residents to be engaged. We, over the last year, have ramped up the number of department emails. Let's say at least half of our departments have email notifications. We have the mayor's newsletter, and we're heavily on social media. And so we've placed the links here for neighborhoods to sign up. And I think that from the community feedback we got, that the community does feel that there are good avenues to take that information and pass it on. I think, in regards to number 5, each neighborhood association would be encouraged to identify a designated communication officer as an information liaison. This would be great. They could, take our information and pass it on. But again, just a little bit more direction here would be good. And then number 6 is to hold an annual town hall style meeting with city council representatives and appropriate city staff, and focused on different regions of Palo Alto. The meeting shall encourage both individual and neighborhood association participation. We'd like to have conversation about this, the number of regions. Would these be full city council meetings compliant with the Brown Act or not? Would the meetings occur at community centers, or are you envisioning them at homes, school sites, parks, churches? So just a little bit of conversation about the thought that the council members had. And then just to be clear on how we want to make these different than the Our Palo Alto events. We've, hosted coffees at coffee shops, slices of pizza with staff. We had the summit recently, so we don't want to duplicate. And then the final element was the evaluate the creation of an ombudsman program with neighborhoods to follow up on neighborhood or resident issues and facilitate conflict resolution. Just again, further direction, and just to remind everyone that we do have the Palo Alto 311 app. This can real-time take pictures and send notifications to the city of any maintenance issues 24 hours a day, 7 days a week. And then as far as conflict resolution goes, we're a little unclear on this. The city does support the Palo Alto mediation program, $65,000 annually. It's a wonderful program. And the organization provides services for neighbors, tenants, landlords, employers, coworkers, local businesses, or other persons and organizations in the community. So that's their mission, and that's a pretty broad mission. So that's it. If I don't know, Ed, do you have anything you want to add, or?
Well, perhaps simply to roll them into a few finite themes as we started the conversation. It appears just in the course of discussion, let me try and identify 4. One would be to recognize existing resources and applications and how those are currently being deployed with the intent of minimizing duplication, certainly building on these existing channels where they exist. Second would be to recognize the variety of situations, a variety of circumstances in which we'd want to approach additional engagement. That applies both to associations and their circumstances, as well as different roles that might occur between the cities and both associations and individual residents, and so recognizing the variety of different circumstances there. Third would be the importance of getting feedback and delving further into communication of what the priorities might be among the array of opportunities we've talked about here. And then finally, the last category I'll classify as infrastructure. And clearly in the comments that were received, great interest in infrastructure in just simply a place to meet. as one of the most basic areas of great interest, but also in terms of infrastructure for communications, and whether it be the ombudsperson concept or some variation on the theme, ways in which we could build on channels for effective communication that don't duplicate, don't get in the way, but that are means of streamlining, connecting residents and associations with the information and the key resources they need with the city.
Okay, thanks. So if I might just say at the outset, before we go into more substantive questions and discussions, as one of the lead co-authors of the memo, I think that the staff has misunderstood some of the intent. So I think we're going to want to start with a discussion around a recalibration of what the intent was, so that we can then have discussions around that intent.
Yeah, sounds good.
Okay. Colleagues, would like to start?
I actually...
Could we hear from the public, or?
Yeah, we can do that first.
I was going to say
Sherry.
Yep.
So go right ahead. Sherry, you've been patient while we had a long other meeting, so.
How long have I been here? No. Okay, I believe you all know me, and I'm speaking as the chair.
No, but introduce yourself anyway.
Introduce
It's for the
myself.
record. That's right.
I am Sherry Furman. I am the chair of Palo Alto Neighborhoods, and I'm speaking on behalf of that association tonight. First, we want to thank you for your recognition of our neighborhood associations as a vital part of our community, and we greatly appreciate your efforts to improve communications. Second, we'd like to keep the process as simple as possible to ensure we don't place an undue burden on staff nor create an unnecessary bureaucracy. We believe the best way to accomplish your goals is to set up a joint meeting between PAN representatives and city staff. Please ask us what we want and need, and what problems are we all trying to solve. I want to make just a few points here. PAN has been listed as a community partner on the city's website since the site's reorganization a few years ago. PAN's webpage lists each neighborhood, its boundaries, and its primary contact person, which is usually the association president. So what I'm saying is this information about the neighborhood, who's in charge and where they are, already exists on the PAN site, which in turn is a community partner. From its inception, PAN has been a networking organization, including mentoring new associations, and I personally have worked with many of them, including Loma Verde and Ventura, and most recently. In effect, we provide a function similar to United Neighborhoods of Santa Clara County. We hold monthly meetings of the neighborhood leaders and distribute information to all of them to then pass on to their residents. We have sponsored, as you all know, council candidate forums, as well as meetings on retail and growth issues, which, by the way, many of these meetings, the city graciously waived fees for the rooms we used. The PAN chair, that's me, has always acted as the city's primary contact point for passing along information to the neighborhood associations. Identifying a communications officer for each neighborhood would simply be a duplication of effort, because I send all of that information to each neighborhood leaders and anybody else who is signed up in the association to be notified. Our greatest need is for places for neighborhood associations to hold community meetings without costly fees. For each neighborhood, these are typically just a few times a year, sometimes 1 or 2, sometimes quarterly. From 7 to 9 p.m. is typically when they happen, and they do not involve alcohol. These are generally information meetings. They are not block parties or anything like that. Few neighborhood associations have treasuries, and finding adequate space for general meetings to hold up to, say, 50 people is often difficult. We generally hold our steering committee meetings in the president's home or something where you can accommodate 8 or 10 people. But our larger general meetings are a little difficult. Regarding town hall style meetings, can you clarify the intent of such meetings? We have always found council and staff quite responsive to our requests for their attendance at our community meetings to discuss issues of interest, such as the recent drought guidelines that staff came to at Midtown. There are a couple of areas we think require discussion between staff and PAN to clarify and define. One, we are unclear how an ombudsman program would work or what need it would even meet. And two, what defines a neighborhood association? PAN believes each neighborhood should determine its organizational structure, be it formal or informal, and this has served us well since our founding 17 years ago. Any additional criteria should be discussed with the neighborhoods themselves. We want to ensure that any requirements do not discourage people from participating in their neighborhood activities. Again, we thank you for initiating this discussion and look forward to working with you. And I'm happy to answer any questions you may have on the points you're discussing, if you need further clarification. So,
I have one quick question.
Go ahead.
So I don't know if it's in your letter. It's in Annette's letter. One of the suggestions for our criteria is that it's listed on the PAN's website under who we are. So the question is, what is your criteria for listing a neighborhood association?
The neighborhoods we use are either long-standing neighborhoods or they are what we are using for emergency preparedness. And usually each neighborhood has somebody, either somebody has volunteered to be the spokesperson or chair or head of the neighborhood association, or in some instances they are the a neighborhood preparedness coordinator that will also send out information to neighbors. So
it's a pretty wide range. In some neighborhoods, it could just be a person who put up their hand.
Yeah, we don't. I mean, I know you spoke about 501(c)(3)s, and we have most neighborhoods are not that because of the filing requirements, the costs. A lot of almost all associations, membership is, if you live in the neighborhood, you're a member. Dues are voluntary. You know, we rely on them to do our for Midtown, it's for our ice cream social, for mailing out a newsletter. If people want to give us money, that helps. You know, otherwise, a lot of the money, frankly, comes out of the volunteer board's pockets for things. So, yeah.
Okay.
Anybody else?
Maybe later. Thanks. Okay, Corey?
So, just I guess maybe a few thoughts to start out. It was several months ago. I think I might have actually been the first person to start reaching out to colleagues about this colleagues memo. Initially, so this will maybe be a start to the conversation about intent and what we're hoping to get out of this. Actually, in the colleagues memo, there's something on page 2, page 78 of the packet under discussion that I'd like to highlight just to start, which is the intention of severability among these items. That that there are some items that perhaps we could move more quickly on, others might require a great deal more consideration prior to implementation. And neighborhood meetings, geographically focused neighborhood meetings, are specifically called out in the colleagues memo as something that we were hoping to move more quickly on. That was the first item that I was highlighting in discussions with colleagues as we started to draft the memo, and then other items were added because we figured that there was there was a nexus here in focusing on strengthening the city's relationship with the community. So just a couple of thoughts about geographically based meetings. Some of my thoughts about why I think they would be important and what those would look like. I think it's important to get the city government outside of City Hall. And that's, I think, good for council members and good for city staff and board and commission members. It's also good for the community. The idea of having a meeting in a particular neighborhood or a sub-region of the city that brings together a couple of adjacent neighborhoods can help help provide a setting and a time and a space where the focus is on the interaction of the city with that part of the community, the interaction of the city government with that part of the community. That would be a good time to talk about events going on in the city, upcoming development projects, redevelopment projects. Particularly as we're working on the comp plan, it would be a good opportunity to work, or to have a discussion about how the comp plan process is going. But at least my own vision for this is that this would be an ongoing process. That this would be whether an annual or biannual cycle of meetings, at a number of locations around the city. I know that our neighbor to the south, Mountain View, has I believe they have a 2-year cycle, and I think 7 locations. So over the course of 2 years, they have 7 meetings in different neighborhoods of the city, at which they have, I believe, 3 members of their city council, every department head or a representative of the department if the department head is unable to make it. And they also have a neighborhood services manager, which might be comparable to this idea of an ombuds person. If we do get into the idea of having a staff person who's dedicated to being a liaison from the city side to the neighborhoods, and so that might be the person, what do you call them, an ombuds person, or a neighborhood services manager, which I think is the name used in Mountain View. That could be the person from the city side. And I'm not saying that we should follow the Mountain View model. I would actually prefer an annual cycle rather than a biannual cycle. I think that what they do is they have a community or a neighborhood committee composed of 3 council members that then attend the meetings. I would, personally, if I'm open to discussion, I would personally rather see the council attendees be randomized and rotating, which would provide an opportunity for council members to maybe go to neighborhoods where they maybe don't have as many personal connections and be exposed, which is good, again, both for the community to get to know more of their council members and for council members to get to know their community even better. So those are some of my thoughts, but again, I think that the idea of having meetings like this is to really focus on what are the issues going on in the city that relate to this part of town, and what are the issues that people in that part of town are facing that they'd like to have the city think about. I'm glad to hear and am aware that the members of the city have been open to invitations and responsive to invitations from neighborhood organizations and from Alto neighborhoods in the past. But I think the point here is that the city should take the initiative sometimes, that we should take the lead. And the question of how this intersects with our Palo Alto, I think, is a good one. Again, my thinking here is that this would be a regular process that we would continue on, and there's certainly a relevance right now in tying it to the comp plan, continuing to get people involved in the thinking about the future of our city with a focus on neighborhoods. One thing you might talk about, in a neighborhood meeting is, how are things going with, say, a single-story overlay or or other design requirements in your particular neighborhood? Is that something that you're looking for? Do you have something that you've had on the books here for a while that you would like to get rid of? But those geographic meetings might be a good opportunity to have discussion about geographically based issues. There are, as far as how many meetings we might have, how many geographic subregions of the city we might have, you could probably break the city down into, you could do it in 30 or 37, or maybe a more manageable 6 to 9, somewhere in that region, subregions. Actually, prior to this meeting, I was just starting to sketch out one way of doing it that would include 9, where you'd have, so just putting this out there for conversation, maybe area 1 would be downtown north, University South, and Professorville. Area 2 would be Crescent Park, Community Center, Duke St. Francis. Area 3, Old Palo Alto, Leland Manor, Market Arrow Oaks, Garland Drive, Triple L. Area 4, Southgate, Evergreen Park, College Terrace. Area 5, Palo Alto Hills, Esther Clark Park, Greater Miranda, Area 6, Barron Park, and Green Acres 1 and 2, and Palo Alto Orchards. 7, Ventura, Charleston Meadows, Monroe Park. 8, Midtown, Palo Verde, St. Clair Gardens. South of Midtown, 9, Adobe Meadows, Meadow Park, Fair Meadow, Green Meadow, Charleston Gardens, and the Greenhouse. But again, there are a lot of ways we could break this down. Just putting that out there for food for thought. I have thoughts about some of the other areas discussed in the memo, but as the memo said, that's the neighborhood meetings are probably the highest priority. So I want to focus on that for now, and let colleagues pass it on to colleagues, and can come back to me when you talk about the other issues.
Okay, go next. Tom?
I mean, you said you actually wanted to redefine it. I kind of wanted to hear.
I agree.
Okay. So there were a few areas where I thought the staff interpretation of the colleague's memo need to be addressed. Let me see. First, I touched on this one about the formal recognition of neighborhood associations. And first, I would say that this is in the category of along the lines of what I think Corey alluded to, is that there are some things that are low-hanging fruit and some things that will be more complex and require more time. This one's more complex and will require more time and engagement, but it doesn't mean it's not important. It just means that it's not something that's a simple, clear solution. I think that means that we're at a starting point, and that basically the council gave a direction. Staff has come back with what, based on some feedback from some neighborhood groups without dialogue, with a recommendation to essentially reject this proposal. And I think that's very premature. So I think what should happen is we should figure out how do we begin to have dialogue, and then out of that we might come to this conclusion, we might come to some modification of it, or who knows what. But this is what we would have as a result of, one, understanding points of reference. How do other cities do this? Doesn't mean we'll necessarily want to copy those, but we certainly would want that as one of the points of reference, including also looking simply within our city at the full range of what we might think of as, we kind of have two tiers of neighborhood groups. We have those that have full-on organizational structures and have for a long while, are very active organizations with committees and great communication structures and some formality, varying degrees of formality to how they run themselves, and others that Sherry described, and I think it's consistent with my experience. Some are someone who has volunteered to be a chair or a spokesperson, and I don't think it's necessarily appropriate nor most effective to place those two types of neighborhood groups as being on par with one another. But what a lot of the intent of this was to respond to what has been for a long while a request from neighborhood groups for the city to have greater acknowledgement of neighborhood groups, greater acknowledgement of the importance of them, and help enable them. And I think part of the apprehension that we've seen from some of the neighborhood groups has been a misconception that would somehow mean the city would be co-opting neighborhood groups. That's far from the intent here. And I think that's a fundamental misunderstanding that has occurred. So, I mean, I saw college terrorists talk about, rejecting a set of top-down standards. I couldn't find that in the memo. It's not there. That could be clearly what some chose to construe, but it wasn't the intent, and it's not the wording. But it might mean that we move toward guidelines. It might mean that we move toward minimum standards, but not prescriptive standards, and there were some suggestions of minimum standards. How do they recognize that there is such a neighborhood group? What if I want to create a neighborhood group that's around my block? You know, and how do we get these things? And you know, that may sound a bit extreme, but that kind of thing we've had historically. And I'm going back when I helped co-found University South at a time when University South had monthly meetings with 50 to 100 plus attendees every month in a very active neighborhood group versus one that today represents a large portion of city population and it is not a very active neighborhood group. Those differences are pretty significant, and we want to make sure that we have a situation where a resident in one neighborhood has a somewhat similar sense of representation through neighborhood leaders that we do in College Terrace and Midtown and Barron Park and some of those neighborhoods where those residents understand how things are structured. Now, it's a valid point, and it was made, that we're not going to have all of those neighborhood groups come up to that standard. So that's part of the discussion that we would have. Then a second point was about the notification about projects. And Corey touched on this, but there are things that go on in the city that are more geographically based. And we have certain formal rules that says within 500 feet of a project, you get a postcard in the mail, and that we put a minimum signage out front that may not be adequate to really inform the residents about what's really going on and how they could engage on a project, engage with their concerns. And so this isn't attempted, the memo wasn't intended to be the answer to that, but the issues are around what kind of things are geographically based. You know, the foothills does not need to have the same engagement about creek flooding down in the flatlands, or tidal flooding, or railroad tracks issues, or various things that are geographically based throughout the city. And so I think the intent was to have staff start thinking that way of, okay, we have different things coming up. Some things are citywide in their interest and dimension, and some things are more geographically based. We kind of have these rigid formulas. If it's geographically based and you're within 500 feet of a project, you get the postcard, check mark, it's done. And I think we want to question whether there are more and better ways to communicate with the different areas of the city. Some are specific to neighborhoods, some are subsets of neighborhoods, some are several neighborhoods that might be. And so it's not rigid, but it's a different mindset about how do we communicate better with our residents and our neighborhoods. On the town hall meetings, whether it's 9 or I think the mayor had talked about 4, I mean, there are good logical ways to break those things up. I think there was just Monday night, there was a reference to when we had our real budget crisis in the recession, and we had a series of meetings throughout town, and to a good extent they took advantage of those well-established neighborhoods and utilize those meetings to really have meaningful dialogue with the community. So what does that mean about these other neighborhoods that don't have comparable neighborhood organizations? They were left out of that kind of communication. So the question is, how do we have more proactive, one, we aren't doing those kinds of engagements unless there's a specific invitation, say to the city manager or the mayor or whatever. So should we be more proactive in this? And second, how do we help facilitate it so that residents in all neighborhoods get some of the benefits of neighborhood groups that we get from our strongest neighborhood groups? So this isn't really intended to undermine neighborhood groups, it's intended to help strengthen neighborhood groups. And then the final one was on the conflict resolution. We weren't talking about what we have. I don't think the intent here was what we have of neighbor-to-neighbor conflicts principally. It's really about neighbor and neighborhood conflicts with city initiatives. And so how do we create a more either collaborative or facilitated dialogue when we have those conflicts between concerns that a neighborhood may have or subsets of a neighborhood may have over what's going on a development project or whatever. And we've had a lot of discussion at council and a lot of examples where it seems to be that the city is acting more in a rule-based environment, and what we want is to have, under appropriate circumstances, or explore what appropriate circumstances we might have more of a facilitated dialogue with the neighborhoods over issues that are not simply, well, you don't like it, file an appeal. And we want to move beyond that kind of setting. And I don't mean to oversimplify it, because that's not the only way the city functions. But the intent is to look for ways to have more effective dialogue and listening to the neighborhoods on issues that they are concerned about, and how do we create that? And once again, the intent was not to, at this kind of meeting, to say, okay, we'll make those decisions here and now. These are nuanced, complicated issues. Now, some of the things we have in here, I think, will be low-hanging fruit, and not fruit we're going to squabble over very much. And other things are going to need thought and discussions, but I remain convinced that they are worth exploring, and that people shouldn't rush to a conclusion because they haven't figured out the right solution. They say this should be a non-issue because they haven't had the dialogue and come up with the right solution. Therefore, let's reject the topic. And actually, these are all topics that have gone around in the city for a long period of time, including in different forms. These are reflecting concerns that have been voiced by the neighborhoods. And I think that there was a misconception and an apprehension that somehow this was a threat to them or a co-opting, and that's far from the intent. But what is clear is that this should be a starting point for discussion around these issues, not leaping to conclusions.
Okay.
Okay, that's my best shot at it. Tom?
Yeah, that's helpful. And I mean, overall, I mean, I support our neighborhood associations. I support the kind of the idea here. I do really think that we can accomplish a lot of this with a pretty light touch and not a lot of staff time. And so, you know, I would like to really see us do that. So I think, again, a lot of those concerns we're hearing was this idea of a bit of heavy-handedness, and I think we can accomplish a lot of this without doing that. So just stepping through, so looking at like number one, we have our partners page on our website. We have a bunch of categories there already. We have friends, official friends of Palo Alto organizations. We have foundations, environmental groups, nonprofits, youth, business, and service organizations like, you know, Kiwanis and Rotary. So adding a category, neighborhood associations, and listing those makes sense to me.
It is there. I think Sherry's made that point. It's under PAN, and if you hit that, it becomes
Yeah, but then you go to the PAN website. So I'm saying, I think it makes sense
Every
to list associations on our website.
Right.
I actually think we should add a second category, which would be citywide advocacy groups. And I think we should list Sky Posse and Palo Alto Sensible Zoning and Palo Alto Forward, and just provide links. I actually wasn't even aware of Palo Alto Mediation, so even though we weren't talking about neighbor-to-neighbor stuff, I think listing them there with a little description would be useful as well. So that's kind of number one. And if we do have an ombudsman, they would also be listed right there with the contact information. So for number two, the criteria, well, getting back to number one, so I guess who's listed as a neighborhood association? I would really advocate for a very laissez-faire approach. And what PAN does, I mean, you look at some of these associations, they're literally one person, right? And it's somebody, maybe it's the emergency prep person, you know, I would kind of adopt that role. And I guess we would have to give a little bit of thought to what happens if two people say they're the head of the association, and how do you validate that? But, you know, I don't think we should spend a lot of time on that. We should think about it, maybe have a process, maybe have a way to deal with it when it happens.
I can tell you, can I just,
Yeah.
we have a history of some of those things coming up. I'll give you an example. When we had the street closures in downtown North, we very quickly had two neighborhood groups battling each other. And there was no way to recognize what was legitimate and what was
I'm not sure the
not.
city should. We could have downtown North 1 and downtown North 2 and list them both, you know, until one of them fades away.
That's what I was thinking as well.
So I do think one of the biggest things here is this idea of providing free meeting space. And I mean, the downtown South, 50 people every month is, you know, I think we probably need to qualify it. You know, I think a lot of the association meetings are small, and then they have maybe a larger general meeting once every couple of months. So if we quantified, you know, a number of no-fee meetings for a group, it would have to be limited, I think. And the biggest question I have there is, what do we really need to know to not have an insurance policy? Like, can the city have an umbrella insurance policy for these groups in some way? So under number 3, I actually thought the staff response was, you know, to use the Know Your Neighbors money and allow an association that wants to go to one of these things to be, for that to be a valid use. So if somebody applies for a grant to go to one of these neighborhood association conferences, that we would accept that as a valid use of that money and just see who wants to use it. Because, again, part of what we're getting in the letters, there's a feeling that maybe that's not terribly useful. So people don't apply for it, they don't use it. On number 4, I mean, the response was kind of, well, people can go sign up on the city mail list. I think the idea would be if an organization is listed on our partner page, that we would have an actively managed mailing list. So, you know, maybe the PR office would have a list for the association leads and would proactively email them or include them on you know, electronic notices, rather than expect people to be active and go register. But again, I don't think that needs to take a lot of time. Number 6, the town hall meetings. I guess when I read that, I was really taking that as more of a Q&A session with the opportunity for neighborhoods to talk to council members, not to meet with staff over pizza. You know, our Palo Alto was very structured meeting with a lot of planning, and I don't think that's what we're talking about. Again, I actually think they could be pretty informal. It could be even a lightweight process that people could request a council member to come to a meeting through the city clerk's office. Yeah, I think Redwood City only has like 2 town meetings a year, so, you know, kind of the number is important. But again, I kind of think we could try it a little bit less structure, but I generally like the idea of getting out in the neighborhoods. You know, maybe we have to have a topic to actually have people turn up, but you know, just the idea of this is a time to talk to your council member about issues in your neighborhood, and just doing that a couple times a year. And then the last one here, the ombudsman. I'm actually wondering if the new code enforcement working director might actually be the right person for that. And it's really just the idea of providing some known level of response to a service level agreement, if you will, SLA. And maybe, again, recognizing when they're being contacted by a neighborhood association leader, the city would know who those people are, and they would, you know, not that you wouldn't respond to anybody reaching out to this person, but that when that person reaches out, you know, they represent a larger group of people. And so they would, you know, maybe get a response a little more quickly. So that's kind of my take on the response.
Thanks. Mark?
I mean, I think I'd probably agree with practically everything Tom said. I mean, I thought it was interesting, you know, that there was concern from our currently organized neighborhood organization leadership, but it sounds like, and hopefully that was just kind of a misunderstanding on a bunch of different sides and a misinterpretation of what the colleagues memo was about. I do think, there are some things that are quite easy fixes that there have been expressed concerns about, including the waiving of the fees for meeting rooms, and I think that should be the top of our priority list in terms of trying to address concerns that we've heard from our residents. For things like creating minimum qualifications for neighborhood associations, I agree with Tom that we're not going to have robust neighborhood associations for each of our neighborhoods, and that's probably okay. And I think as things pop up in different neighborhoods that attract attention, then they'll strengthen, and then they, hopefully, that doesn't happen that often, and our residents are kind of content with the way things are going. I just want to make sure that any structure that we created wouldn't eliminate organizations from existing. I agree it can be complicated when there are numerous organizations that are created in one neighborhood, and I think that's something that merits discussion, but I wouldn't want to add on too many other requirements. I wouldn't, maybe I still need to understand a little more the purpose of the ombudsman, or if that can be something that's just kind of folded under somebody that is already on staff, or the new code enforcement officer. I don't think we'd want to hire somebody specifically to play that role. And I don't know if that was the intention or not, so I'm not claiming it was, but I don't think that's something I would support. And that's kind of, and let's make sure that we have robust interaction with PAN and our residents who are concerned as we go through this process, so that everybody gets to provide feedback.
I've got some more thoughts following up.
Go ahead, Corey.
So, yeah, actually really appreciate the other comments I've heard from colleagues. Regarding some of these other things, and actually looping back first on the geographic meetings, the town hall meetings. My inclination would be to have it be formal in the sense that it's well noticed, it's regular, like on the calendar months in advance, so that people can plan to be there, so we can do really robust outreach to the neighborhood to make sure, or sub-region of the city to ensure that anybody who wants to come can arrange it on their schedule. And something I'd forgotten to mention earlier, that Tom did mention, is really important, which is the opportunity for dialogue. So I think some communities, when they do this, and this is maybe good. I don't know if when it comes to interaction with staff or whatever, if we're going to call for a more robust study of other communities, but the idea of having some staff presentations, maybe go through, introduce whatever department heads or council members are there, talk about what's going on in the city. Here's some of the stuff that's coming down the pipe in your neighborhood. Here's some questions we have for you about what you'd like to see in the future of your neighborhood. Do you want some kind of architectural overlay? Do you want a shuttle route that comes to your neighborhood? Those kinds of questions that are will change from year to year, but where the city and with the things we're looking at over the next couple of years, here's something where we need this neighborhood's input, and then definitely dedicate a significant chunk, if not the bulk of the meeting, to Q&A. As Tom pointed out, really good chance for the people in the community to say, thank you for coming to our part of town. Here are our gripes. Here are our questions. Here are our concerns, and that's I think a really key focus. I think that others might have different thoughts. I think that the real key behind the ombudsperson or something like that is really constituent services, right? It's it's a point person to handle complaints and questions, right? And point person who can facilitate responding to issues. And thank you to staff for pointing out the Palo Alto 311, which is a great thing. I even have used it myself. But sometimes having the personal touch of somebody you can call is great. on the issue of how we recognize neighborhood associations. Is actually the term that Tom used was one I had a couple times in my own notes as I was thinking about this before this meeting, which is laissez-faire. If we do have, as others have mentioned, if we do for a time have 2 neighborhood associations within an overlapping area, I would be okay with listing them both, listing links to both on the city website. The point is to provide a facilitation of Palo Altans connecting with other Palo Altans, particularly in their part of town. I also think that if we can start exploring, free space and not having to go through the hassle of and cost of paying for insurance for finding a facility, whether that's city facility or partnering with other organizations in town who might be eager, to open their doors and provide space for the neighborhood, whether that's the school district or nonprofit or even a business that's interested in partnering with the neighborhood. They get some good PR out of it too. I think that would be great. Those are, I think, my key thoughts for now.
Great. So I had a few follow-up thoughts. One is, how do we break up these items into things that we can give guidance on right now, and which ones get carried over with what guidance goes with that? So under point number 1 of the colleagues' memo, we really have 2 paragraphs. One that's much more simple, which is to have richer content about the neighborhood groups on the city website. I think it's very valuable to have PAN there, and then also the neighborhood groups, not one or the other. And I think it'd be great to have good interactive maps so that somebody can go there and say, oh, I live here, or it must be this neighborhood group, and here's who I contact. And then the second part, I think, is one that we want to give some guidance for how we would proceed in that discussion. And one thing that we may want to be thinking about is whether we should support the mayor appointing a couple council members to work with an ad hoc group of neighborhood leaders to talk through these different other sub-issues and come back with some recommendations. But one thought that occurs to me, and I've seen it at some of the arguments against, as well, we can't force neighborhoods to necessarily, we can't force some neighborhood that doesn't really have a formal group and just has somebody who volunteered to be a spokesperson have the same organizational structure as some of our full-flushed and strong neighborhood groups. And it wouldn't be the intent to do that. It would be, I think, valuable for the city to help facilitate neighborhoods groups being as strong as they wish to be. And so a lot of people don't know the history, but I mean there have been strong neighborhood groups in the city for a long while, preceding 20 years ago when I got involved. But when we created University South, we actually had some folks who borrowed off of neighborhood group models that were from outside of Palo Alto and brought them in as recommendations. And we went through the typical process of a bunch of months of figuring out what our protocols and bylaws ought to be in. And that's a formality that not every neighborhood group's going to want to go through. But in the end, the neighborhood in that period of time got recognized as being very effective and a model that not only the city said, well, gee, this works well. This neighborhood is influential and constructive at the same time. And other neighborhood groups came and said, we want to talk to you about it. Your template was, by all means, we don't own it. We'd love it. And we passed along the template, and other neighborhood groups borrowed portions of that, and that helped strengthen them. And at that time, there was discussion about, well, gee, why doesn't the city do this? Why does every neighborhood group have to talk with each other? Why doesn't the city say, oh, here's a good template? It's not a requirement, but let us help you. If you want to create a strong neighborhood group, here's a model or a couple of different models that you can choose from and cut and paste and do what you want. But you don't have to reinvent the wheel yourself or do all your own research if you want to strengthen your neighborhood group. And on the other hand, if you don't want a full-fledged one, so what's that second tier neighborhood group? Should it be just that, well, the one guy who is most passionate on the hot issue in the neighborhood becomes the de facto representative for 1,000 people who live there? I don't think that's ideal. And so maybe we create a second simplified tier that says, okay, here's tier 2. And we have the full-fledged neighborhood groups that have certain minimum requirements, but the others are still recognized as neighborhoods, and that there's some designated person, however that might get set up, and this would be one of the things that would get discussed through this ad hoc committee. And I would frankly recommend that the ad hoc committee include one or more neighborhood representatives from that second tier that really isn't the strong, fully fleshed out neighborhood group.
Can I ask a quick question? Because to me, it already gets really tricky. There's not this clear separation in my mind. We just had Palo Alto Common Association, which is a building. Is that tier 1, tier 2? I mean, would that even be recognized?
And we had somebody represent that they were representing that organization.
Yeah, there
which
was
they
a-
weren't, by the way.
Yeah. So my answer to that would be, we don't resolve that tonight.
Yeah.
That's part of what would go into that discussion. I will say that going back a long while, and if you look, when we started University South, I was given a list of all the neighborhood groups that the city had a list of that went back the previous 10 to 20 years. And I went through, well, half these, I don't know who these guys, they don't seem to exist anymore.
Right.
And a number of them were neighborhood groups, and a number of them were essentially homeowners associations for condos and things like that. So we didn't have something that resolved that issue, and I would say that's a topic for this group to explore and come back with recommendations, as opposed to us necessarily having the answers tonight.
If don't mind, I guess what I was advocating was we don't spend staff time on that, and we just adopt more of a laissez-faire attitude. So I guess the question is, like, how much effort do we really need to?
So I actually wasn't saying that this would necessarily be staff-driven.
Yeah.
This would be a couple representatives of the council and representatives of different neighborhoods to go and have an ad hoc group to flesh out issues. I don't think that it's also, I don't think we're prepared to say it ought to be this and that, and I don't think we're prepared, in my mind, to say it ought to be just laissez-faire either, right here and now. I'm not advocating that we come and conclude one thing. I think this is the sort of thing that we should have more dialogue on. We may come up with the agreement is your laissez-faire proposal.
I guess I was just assuming, even if it was a council subcommittee, that there would be staff dedicated to organizing those meetings.
Oh, they could help facilitate it, but I don't think there's a difference between being staff-driven and staff present.
Could I just add one element of that in your discussion?
I want to make sure the mic is on.
Is next door. There's some neighborhoods, and I'm not sure if they're exactly aligned how PAN is, defined their neighborhood. So there's that part, and that may not matter if you're not really, caring. But there are maybe different designated leaders of that neighborhood group. We have about 10,000 residents who are on next door, so that's a good chunk. In some neighborhoods, it's up to about 40% of the neighborhoods on next door. So in your thinking about sort of how, who to invite or how to, organize that, it should be, I think, at least part of the discussion and dialogue, because it may be a lot of the same, and it may be some different folks who have not been typically part of the neighborhood association.
So that brings up an interesting concept. Next door is not currently organized according to our neighborhood groups, but they might be willing to be. They might be willing to break up themselves according to what our neighborhood groups are already organized by, because people want to be able to talk to people in their neighborhood. Let's see.
Do you want to ask Claudia to identify herself just for the record?
Okay.
All right, Claudia Keith, Chief Communications Officer.
What was the? I've lost.
The other point was that there are some who, for example, started their next door social media network that could be leaders that may or may not be part of the Palo Alto neighborhoods.
So,
but
it's a good point. So where we lack formal neighborhood groups, we may be starting through next door to have grassroots occurring. But the one that's been strongest in recent years on that is what Sherry alluded to on several, which is the emergency preparedness. And that's created a whole group of people who have become active in their neighborhoods because of the block preparedness coordinators and CERT initiatives. And that has been, probably in the last decade, or maybe a little less than a decade, the strongest change that's happened in our neighborhoods has been that additional layer on top of kind of the government affairs and the social stuff that existed before. Now we have that other dimension, and it's valuable. It's valuable to the city. It's created, in many cases, either stronger neighborhood groups where they existed, or de facto neighborhood groups where they really didn't exist before, but they're now organized to some extent around the presence of that initiative. So I think these are all good things to talk about. I don't think we're prepared to draw a conclusion tonight on.
Yeah. So I'm looking at the clock. It's 20 after 10.
Okay.
Where do we want to end up?
I would recommend that we call out the things that we can make recommendations on tonight that would go to council, and others that would be carried over. But if we can't even get to that point, we may have to carry over the balance of the item, because it is pretty late for a P&S meeting.
So the one thing that, as I mentioned before, the one thing that's called out specifically in the colleagues' memo as an initiative that we'd like to launch, it actually said early this year, although it's already halfway through the year, so that's not going to happen. But earlier than others is setting up meetings that are initiated by the city and by the city establishment in different communities within the city. So we've offered, some various ideas about that. Might it be good to, at this point, direct staff to put together some more clear proposals and bring that either back to Policy and Services following the break, or directly back to council following the break?
So I think it does need to be vetted by P&S before going to the council, and so I think we can give that guidance. I would suggest on that we, if we're going to do that, say that we would like staff to come back with draft recommendations on number and form of town hall meetings, and so I'll make this in the form of a motion, and that that where possible, those town hall meetings would be coordinated with one or more neighborhood groups.
I mean, I guess I have a question for staff.
Well, let me see if there's a second, and then we can have a discussion.
Okay, I mean, kind of just wanted to see if we could
I'll
generalize.
Well, but just
I'll second
motion.
it, and,
Okay.
but open to amendments.
Okay,
and
so I'll
questions.
pass on other discussion. Do you want to speak to your second?
I spoke at length earlier about this topic.
Now, Tom.
So I'm wondering if we could generalize your idea, and if you guys got enough feedback from us that we could almost treat this as a study session and just move more generally, that you come back with an update to all the elements with more specifics, kind of numbers 1 through 7, including the town hall item.
I would suggest that we also do that as a separate motion, again, focusing on the severability that was highlighted in the memo, so that we can move on the one, and then, because I think that one, hopefully staff can start really working on that, with specific proposals, whereas with the others, staff might bring back more informational.
Yeah, that's
I would agree. That's any that we can carve out with clear direction. Let's do clear direction. But let's not get hung up until 11 to try to. If we find that we're struggling to agree on clear direction, then let's agree that we'll table that and let them come back with a little, based on what Tom described as our kind of the informal input.
Can I take a moment to just interject a legal aspect? Felicia Gross from the City Attorney's Office. So clearly, for the town hall and the Q&A sessions, the Brown Act would apply, and there's a strict interpretation of the Brown Act which would suggest that no more than 2 members of one committee, so for example the Policy and Services Committee, no more than 2 members could appear if there are questions that are likely to be asked or discussions are likely to be had that may return to Policy and Services. So something to be cognizant
I'm
of.
sorry, isn't that only if they participate in those discussions?
Sorry, when you say they, meaning?
Those 2 members of, say, Policy and Service, more than 2 members of Policy and we can be there as observers, correct? But it's only if we're participants does it apply.
I think that's correct, but if it's a Q&A type situation, to decline questions, it's just something you'd have to be cognizant of.
Right.
Or defer them to staff.
But I'll give you an example. When we had the town hall meetings that the city manager led during our budget cuts, there were council members there, but to my recollection, the council members didn't participate in the Q&A. So it would. So I appreciate the warning, but I just want to make sure it's understood that there's a difference between attendance and participation, and that you start getting nervous if we're attending and we might slip into participating, and I appreciate that.
And actually,
Go ahead.
well, I was just going to follow up on that and say, so for staff, as you bring back draft proposals, to keep this in mind, as I had suggested tentatively 3 council members per meeting. This might mean that we're careful about how we divide up which council members go to which meetings.
Exactly.
Well,
or the number, so that's just something to consider.
The whole intent is to participate, not to go and not say anything.
Right. And so, thank you definitely for mentioning that. And something I forgot to mention earlier that opened to colleagues' thoughts on this. In addition to staff and council members, another group to draw on as appropriate for this type of meeting, I would suggest would be board and commission members, particularly, especially over the next year or so as we're working on comp plan stuff. I would say Planning and Transportation Commission, as well as Architectural Review Board, representation from those bodies I think would be particularly advisable, but other boards and commissions as well.
So I'll just briefly say there's a good example of why these where these geographic-based town hall meetings might matter. If we have, as part of our comp plan discussion, a discussion around South El Camino specific plan. We've got neighborhoods of Ventura and Barron Park and the Green Acres and Orchards, and they'd all have an interest. The rest of the city generally wouldn't so much. So that's kind of the example. Okay, so we have this one motion before us. Does it need to be repeated? Okay.
Trevor, may I make a suggestion? And I certainly don't want to get ahead of the committee, but just to follow up on Councilmember Du Bois' comments, it seems from my perspective that there are about 3 or 4 recommendations that would make sense to bring back to you.
Okay.
One would be about the town hall meetings, and that would include kind of an analysis of resources needed to do that. The second one would be about the fees and the insurance, and again, there's some resource implications and cost to that. The third recommendation would be about, and I don't know if it would be a recommendation because I think we got the gist, would be around enhancing the website, and we can start working on that again. I don't think we need a formal recommendation, but again, we couldn't have one there. The fourth recommendation would be about this ad hoc committee that you had mentioned, and that then I think would tie in to these other issues, which is the definition, communication, and how that's syncing, as well as the ombudsman program. So I don't know if that helps your organization.
So I think you've convinced me that Tom's recommendation would cover what we're...
Yeah, so the other one, the easy one, would be this idea of
city funds to attend association
Correct.
conferences.
Yeah.
Could we just roll that into the block grant program?
Yeah, we'd want to bring something back to you on that. Right now, the Know Your Neighbors grant program has clear purpose and principles and definitions, and I do think this fits into it. It's becoming a very popular program. We have over 40 applications this year and only 25,000, so that we could make a recommendation to increase funding and re-massage the purpose.
So I would say that I think that's a good idea, and I was going to comment that we within that re-massaging, it's not just attend conferences, but I know that neighborhood groups, especially when things were trying to print flyers, if you don't have an email list, you still have to go door to door to first start forming a neighborhood group because you just don't have that email list. And so just getting the funds, if somebody's trying to form a neighborhood group, it was always, God, I got to pay for $300 out of my own pocket, and the sweat labor. So making some of those funds available to neighborhood groups for some of their minimal purposes and would be something to consider.
So procedurally for this evening, so we can all wrap up in a timely fashion. Should we amend the motion on the table, or should we just pass
So I
that one
will.
and then move to the other?
So I am comfortable with accepting what Cash described as their intention and withdrawing the motion.
Okay. And then so we would return back to the committee as soon as possible. I would think,
You missed it all, Sherry.
Maybe they return in August or September.
Okay, so the motion is not necessary for that.
Yeah, and then.
Fine, that's okay with me.
Great.
Yeah, that's good.
Okay. All right. Anybody else have anything more on the item? Okay. Great. And then, since we are not proceeding with item number 3, shall we go over our draft schedule? Allocation or anything to do?
Yes.
Sure.
Okay.
So we don't have the first 3 items in orange are what occurred tonight. We'll obviously push the city council procedurals matters to August. I do apologize, I didn't include August in here. In August, we also had the item for the handbook, which is going to come to the committee.
So what's our August date? Because we don't have one.
Yeah, I needed to circle back with Councilmember Du Bois about it was either the 16th or 25th. We kind of picked 2 dates, and I was supposed to check back with him, but I didn't. I haven't yet. I don't know if we can formalize that tonight.
18th or the 25th?
Was it the 18th or 25th?
Yeah. So I believe the 25th would work well for me.
Okay. And does that work for other council members? I believe it did.
I'm sorry, could you repeat the date again?
August 25th?
Yeah, it's fine for me.
Looks good.
Okay.
Yes, that's fine.
Okay. So at the August 25th meeting, we'll bring back the procedural matters, which is on the agenda tonight. And then from our previous meeting, we had said that we would bring the handbook back. So those would be the 2 items there. If we can turn the staff report around and the recommendation analysis, we'll bring it back there, or at least get it on the agenda. For September, it does look like we've got a pretty full plate. The approval of the Junior Museum and Zoo collection policy, the 2 auditors' reports, and then the records retention policy from the city clerks. And then we've just got some tentative placeholders for October and November for the public art ordinance and the human resources allocation process budget. And then we do have these pending items that we're still working through to bring back. So it does look like we're having a very successful year so far. And
So on the, I guess one that's in the parking lot here,
Yeah.
the health and safety funds, Project Safety Net, how different would that be from, I guess, the budget process?
So, and I mean, Chair Burke can correct me if I'm wrong, but the way I understood it was that, as Jim mentioned this evening, when we had this item in October, there was the discussion about the $4 million total, 2 million have been allocated to Project Safety Net, and that's what I think you're talking about now. But then that other 2 million is still kind of hanging out there, and what do we do with that money is what that conversation's about. And that's where there was this larger conversation about the guiding principles of how to use those funds.
And do you think when we're talking about the meeting rooms, might be able to roll in the Alma Plaza meeting room discussion?
Yes, and that, yes, we should be able to, and that, I need to circle back with Walter, our budget director, because I think the user fee cost recovery policy has already come to council, and we need to wrap all this together.
So I have a related question, which is, in addition to neighborhood groups, there are other nonprofits in the community that we may want to enable to use community, and these may be informal or unincorporated nonprofits. We might find it as a community benefit, whatever they're providing. And so I'd be interested in including in that discussion what are the parameters and how might we, if we chose to do so, how might we or staff identify a process for organizations to apply for exempt status from fees for community facilities.
That might help, and this is
Claudia, your mic.
Yeah. Claudia Keith. So that might help also define. You know, we get a lot of requests to be put on our website, a link to our website, and you know, we don't really have criteria. I mean, there's lots of good nonprofits, and so that might be a good way to just sort of have some criteria. I know we want to be loose and open, but not chaotic, so that might just help sort of for us to be able to say, here's the
Goldilocks version.
right.
We need
a lot of people do want to be linked to our website, so just
you almost need a chamber of commerce for the nonprofits, right? Like an
like
organization, right?
Yeah. So anyway, it's just something.
Okay. Does that cover it? Great. Meeting's adjourned. Oh, I almost let it slip. Something happened with the Warriors, Tom.
Yeah.
It was not a tie.